Good afternoon, Raj.
Christy, good afternoon, Christy. It's audio.
Okay. Yeah.
Yeah, sharp start.
Yeah. Sure. I'll just I'll mute myself. Okay. Yes.
I can unmute now. Can you hear me now? Yes. Okay, thank you. Thank you. Hello? One second.
Hello.
Hello, yes, madam.
Sir, can you
Can you
hear
hear me? Madam? Yeah, I can hear you. Yes.
Okay, sir. I think we are okay.
Do you have any PowerPoint to present?
Yes, sir. I'll just share the screen so that
Yeah.
we are able to.
Yeah. Yes.
1 minute. Yeah. Can you see?
Yeah. It's very clear. It's visible. Yes.
Okay, sir.
Thank you. Start in exactly at 2:30. There will be a welcome address followed by your session.
Yes, sir. So are we in the waiting room as of now, and then will you be?
No. Already you are in. Actually, we are in
Okay.
waiting.
Okay. So I've just switched on that presentation because I think the welcome screen was there. So
you can close now.
yes, I have stopped sharing.
You can stop sharing. Yes.
I've done that, sir. I've stopped sharing.
Okay.
Yeah.
Hello, checking. A very good afternoon to one and all. I, Anne Louisa from first year MSW, take this privilege to welcome you all for the second day of the webinar, Scope and Challenges of Women Migrant Workers Post COVID-19 Pandemic, organized by PG and Research Department of Social Work, Sacred Heart College, Tirupattur, and funded by National Commission for Women, New Delhi. I now request Dr. C. Christy Anandan sir to address the gathering.
Good afternoon to all. It is my pleasure to welcome you all at this gathering. My dear organizing team, resource persons, and participants of the program. We have this pleasure and hosting this particular program, this webinar on scope and challenges of women migrant workers in the post-COVID-19 pandemic. Yesterday, starting with the welcome address of Reverend Dr. John Alex, Secretary, Sacred College Society, to the special address from resource persons, we had an enlightenment of the reality picture on the hardships of the women migrant laborers. As we listened to them about various types of problems and challenges faced by the women migrant laborers, it is also very important that we should understand the efforts and strategies to mitigate these problems. As poverty have forced many of these families to migrate and earn their livelihood, but the same condition is taken as an advantage by the capitalists to exploit these people. Therefore, it is our duty to intervene with right strategy to protect the rights of these migrant laborers, especially the women. I'm having the pleasure of welcoming Reverend Father Andrews Raja, Head of the Department, PG and Research Department of Social Work, Sacred College. The eminent speakers of the day, Ms. Padma Priya, Ms. Lata Munuswamy, and Dr. Soumya Shankar, to this webinar to enlighten us. And as participants, I welcome you all to take an active participation. Yet I also would like to make an important note on the efforts of Dr. K. Arakiraj in organizing this program. We appreciate him for bringing us together with apt titles and suitable speakers to enlighten us. I welcome you all to listen to the eminent speakers of the day for greater insights. Thank you all. Welcome you all.
Thank you, sir, for extending a warm welcome. I now request Father Henry Daniel Ambrose to introduce our speaker for the third session.
Good afternoon, one and all. I'm extremely happy to introduce Ms. Padma Priya. She has over 20 years of experience in top management roles of leading international development organizations such as CARE, Save the Children UK, University of Washington ITech, and the British Council, to name a few. Prior to her current role, she was the country director of Good afternoon, one and all. Am I audible?
You are audible.
Yes. I'm happy to welcome and introduce Ms. Padma Priya. She has over 20 years of experience in top management roles of leading international development organizations such as CARE, Save the Children UK, University of Washington, HITECH, and British Council, to name a few. Prior to her current role, she was the country director of Lebara Foundation, the philanthropic arm of Lebara Telecom in the UK. Priya has specialized in strategic planning, operations management, grants and budgets management, policy development, and internal controls for the non-profit sector. She is an associate member of the Institute of Cost Management, Accounts of India, and holds master's degree in commerce as well as business administration with specialization in human resources from the University of Madras. She also holds executive certification in global health management from the University of Washington, USA, executive certification in change management from Indian Institute of Management, Kolkata, and strategic HR management from Loyola Institute of Business Administration. She is also a trained social return on investment practitioner from Social Value, UK. She has extensive experience in recruiting, training, and working on governance boards. Priya has been awarded the Rotary Vocational Service Excellence Award in 2014. She is among the top heritage bloggers of India and is a heritage researcher, walk curator, speaker, and published author. We welcome you, ma'am, for this afternoon session.
Thank you. Thank you so much. Good afternoon, everyone. At the outset, I would like to thank Sacred Heart College, Tirupatur, and Dr. Aragiraj for inviting me this afternoon to be part of this very esteemed gathering. The young development professionals in the making. So this topic that we have been discussing since yesterday is something of imminent importance because the lockdown, we all would agree, has thrown our regular lives and livelihoods out of gear. But then, if we were to look and apply the same rule to the female migrant workers, it has made their life much more difficult to manage. So I'm sure you've been hearing all about this from yesterday. The topics are interrelated and they're likely to be overlaps. So please bear with me if I'm speaking the same things that you have already heard yesterday. Unfortunately, due to prior professional commitments, I could not join the discussions yesterday. But then I truly feel there's nothing wrong in repeating those things that we have already spoken about yesterday, because these things need to be ingrained in our consciousness if we have to make a very conscious effort to make a change in the lives of these people and to advocate for their rights and privileges. So if we are ready, with no further ado, I will move into the presentation. Right. So the first topic for today is the role of NGOs and industries in sustaining the wellness of women migrant workers post COVID-19. So the role of NGOs and industries. Now, this is something that we have to very closely observe. It's a very good topic, and I'm really thankful that I got to speak about this, because the NGOs kind of serve as the bridge in connecting industries. On one hand, the industries have the legal and the statutory responsibilities to take care and sustain the wellness of the women migrant workers. The migrant workers, on the other hand, have the role of working in making these industries achieve their outputs and their profit targets. And it's the NGOs, the civil society, which kind of brings these two together to make sure that it is a complete harmonious circle. Now, some points that I wanted to kind of place before you, before we move into the other details of the presentation, is in India, as far as 2020 was concerned, there were 140 million migrant workers. Not a small number at all by any yardstick. And more than half of this 140 million, so more than 70 million of those migrant workers are women. And from this 70 million workforce, there are 57.4% that migrate after marriage. So migration is not something that by choice as far as women are concerned. In majority of the conditions, there are several studies that have been undertaken in India which show that the major reason of migration as far as women laborers are concerned is marriage. So they move from probably the father's field to the father-in-law's field to be an agricultural laborer, from an industrial setting in one town or city or village or whatever, semi-urban area to another area purely by choice of marriage. They could be working in structured or in non-structured settings. So in an organized sector or in an unorganized sector. And one point that we often tend to ignore, because whenever we speak on migrant female laborers, we are often talking only about those workers that are working on daily wages or working in unorganized sector. We also have to keep in mind that there are several of them who migrate after education to take up jobs in other cities, could be in the IT sector, could be in the telecom sector, FMCG sector. So we also must not forget about this group of migrant female workers who may not be in the bottom consumption quintile. Right. Now to move forward. Yeah. So if you look at what is the percentage that the women migrant workforce is in the total workforce of different sectors. I just spoke about the rural and urban sectors where we find the female migrant workers. So you see in the primary sector, 75% and 65% is women. Manufacturing 59 and 51. Public services 69 and 56. Construction 73 and 67. Traditional services 65 and 55. And modern services 66% and 52%. So overall, we have in the rural sector 73%, urban sector about 56, and then they average out to be a little over half of the total migrant population in India. So this is as per the 2007-8 NSS survey. Of course, the figures have since changed because the data that we saw in the previous slide was of current or of recent origin from 2020. But nonetheless, it does not reduce the importance or significance of women in every sector that is there to consider as far as India is concerned. You can see the comparative figures for men, and then you will see that why it is so important that we are talking about the subject that we are talking about currently. Right. So all economists, everyone agrees that migration is crucial for economic development, because otherwise, development would be concentrated to certain cities or certain areas in the country. And for all-round development, all-round growth, all-round economic, growth, we need to have migration. But then, what does this mean for women? What are the risks and challenges that women face? I know that there has been a session fully focused on this yesterday, so I'm not going to go into explaining each point that are there on the slides, but I most definitely want to touch upon them, because there could be something there that probably would trigger thoughts in your own mind, because I'm pretty positive that your your discussions or your thoughts or even your informal kind of communication within your group is not going to stop with this evening. I'm sure there would be at least a few of you who would want to take these discussions forward and probably come up with some action steps on how you in your own small way will be able to address this particular issue. So as I mentioned, yes, so they don't have any choice. They migrate post marriage and take up whatever livelihood is available for them in their husband's or the spouse's location. Very often they are the invisible working class, because people who are, as I said, working in agricultural fields that belong to their families, who are providing labor in sole proprietary concerns or family concerns that are run by the spouses, the entire domestic, the workers, the housemaids, the caregivers, the cooks. All these people, are mostly women, but very often they remain an invisible working class. They do not come into the forefront. They don't have an association or forum which kind of, represents their collective bargaining or, advocates for their rights and privileges. Most of them work in the unorganized sector, as we all know. The difference between contractors and agents in a variety of ways. I thought, it's important for us to discuss this, because a contractor is somebody, like most organizations today do not want to take the responsibility of providing the statutory obligations for their support staff. So most of the people who have the lower rung of the organization are often outsourced through a contractor. So you would have the housekeeping staff, you would have the cleaning staff, you would have the pantry staff, the security guards, the other support staff that are required in an organization are most often today outsourced through contractors. So what do these contractors do? They would collect the payroll or the wages on behalf of this employee. They would take care of their social security obligations and then pay them the money that is due to them. So at any given point of time, the contractor is the person who is accountable to sustain the well-being of these workers based on the money that he or she receives from the organization. But then who would be an agent? An agent is someone who would merely recruit these migrant female workers for an industry, and then he has nothing to do with them. So he would probably go and talk on behalf of the industry. Must have heard of the Sumangali scheme. I have probably spoken about it yesterday, something that has been eradicated on paper, where these agents used to go to households and tell the mothers that if they sent their daughters to the textile mills to work for 3 years, 5 years, at the end of the period, they would get a sizable sum of money, which would be adequate to get these girls married. So mothers who did not have any other option of getting their girl children married, parents would agree to this, and so a small amount or a lump sum amount would be given to them in the beginning, and after which they would go there and they have to accept whatever wages or whatever living conditions or working conditions are offered to them. So this is something that we also have to keep in mind while we are discussing migrant workers. And then, most of the time for the migrant female workers, there are unregulated work conditions and pay. I see a hand raised, but can I request questions to be held till the end of the session, because I'm conscious we only have 30 minutes for the presentation. At the end of the session, I would most definitely be happy to answer any questions that the audience might have, as long as my knowledge and experience is concerned. In case there's a question that I'm unable to answer, I'd most definitely refer and come back and send you an email on it. I hope that's okay and I can continue. Right. So unregulated work conditions and pay, mostly in the unorganized sectors. There are no minimum wages. There are no stipulated working hours. There is no overtime if the person works longer than normal 8-hour period or a 10-hour period. They have to work probably all 7 days of the week and so on. Mostly, I would say almost everyone does not have any access to government schemes or social benefits. The most important or significant challenge that these women face is they don't even know what are their rights and privileges. Almost complete lack of awareness about their rights and privileges, unless these NGOs kind of come there and then work with these people and educating them about their rights and privileges. There could be unscrupulous agents who are exploiting these women by saying, every day you hear about international migrant laborers who are taken to other countries, and then there they are recruited as housemaids and cooks, but then they are trafficked. So we keep reading about this all the time, which leads into the next point that has been mentioned there. And then, of course, the bonded labor, entrapped in debt and bondage. So very often, if they have no other choice of a livelihood, or they are in debt and they need to settle the debt, these women agree to be in bondage and they go and like in the bricklin industry, and the government has taken a lot of steps to relieve them out of this bondage and then make them live a normal free life. Poor and unsafe working and living conditions. I don't have to explain this. I'm sure all of us are aware. Low wages and very long working hours. Basically, they do not have a life outside of the industry in which they are associated in, because they live in the dormitories. They work till whatever time, till dinner time, and then they just go and sleep. So low wages and very long working hours. Several occupational hazards and health and safety challenges dependent on the industry in which they are associated. As I said, if they are in potential forced or bonded labor, there is even lack of freedom of movement for them. They can't even go back and visit their families, or travel outside of the setting that they are kind of restricted to. There is possibility of violence, there is possibility of harassment, sexual abuse at workplace. We keep reading about all these things on different occasions. Lack of nutrition, because they hardly get nutritious meals. They have to eat whatever is served to them in the canteens. Very often these may not be nutritious, so they could result in their anemia and other health conditions for them. They could not be allowed to participate in civic responsibilities like voting, because they do not have any enumeration in the city where they are working. And the government schemes has been repeated, so very often they are not part of government schemes. We do not have any reliable data about all the female migrant workers, other than census and NSS, which is not something that is constantly updated. There isn't any data which is all encompassing of all the industries and of all the women in different nature of jobs in these industries. Domestic workers, we have already spoken about this, totally outside the gambit of any data, any regulatory or welfare activities. And very often industries take the statutory thresholds as an excuse to provide benefits to the migrant workers. For example, for maternity, there is a threshold of 50 workers in an organization. Social security benefits, 10 workers. So what they would mostly do is not take 10 people on payroll, keep them all as weekly paid or daily paid, so that they don't have to provide all these benefits to them, which is very, very difficult and completely discriminatory against women. Now, on one hand, we have spoke in the last two slides about what are all the situations on the ground for which industries or the middlemen or the environment might be to blame, or in many reasons the laborers themselves could be the reason to blame. But what is the welfare state? What is the government doing in this case? So rather than completely resolve these issues and appreciate and take on women as a very significant workforce which needs to be protected and their well-being to be sustained across the board, sadly, we are in a situation that we haven't yet reached there. The added woes of a legislation gap, when you look at a definition of an interstate migrant worker, according to the Interstate Migrant Workers Act of 1979, you would find that it defines it as a person who is recruited by or through a contractor in one state, or it could even be an within intrastate as well, under an agreement or any other arrangement for employment in an establishment in another state, whether with or without the knowledge of the principal employer in relation to such establishment. So as I mentioned earlier, contractors kind of come under the law to a certain extent, but completely agents are not at all considered. Now, with or without the knowledge of the principal employer in relation to such employment kind of also lets the employer go scot-free, because tomorrow there is a problem, the agent is not going to take responsibility. The employer need not necessarily take responsibility. And so that particular migrant laborer is completely defenseless in that case. There is absolutely no mention of women or any special preferences in the act at all, other than the maternity benefits that are mentioned. There is completely no mention of women or any special preferences. Of course, equal work and equal pay is mentioned, but then we all know, and so I am not going to be elaborating on that. The other sad thing is that the role of inspectors, ideally the inspectors should be the ones who should be tasked with sustaining the well-being in these industries. They should be the paid authorities by the government to make sure that the industries are providing whatever welfare benefits that are required for the female migrant workers. However, the role of inspectors is only reduced to compliance and facilitation. So they just go there, and if the industry is not doing something, all that the inspectors will do is fine them for that particular thing. They would only, so it's only a question of either facilitation or kind of, they only have to fine them for statutory compliance. There is no way that these people can enforce the well-being to be maintained or sustained. And then, the legislation has not implemented vital point like compulsory registration of every single migrant at the destination location and linking them up with all the government welfare schemes. This is still very loose, and although after October last year the registration is available online, the kind of supporting documents that a worker needs to be registered are very, very difficult to obtain. So and obviously they're not going to lose wages, go and stand in the line. If they are not able to do it online, they have to actually go and wait in line to get registered. So all these are things that are not practical or customer friendly for the migrant workers. Okay, this is a screenshot that I have taken from the National Commission for Women website, which lists the laws that are currently available in India relating to women. So you would see that there is an Immoral Trafficking Prevention Act, there is a Dowry Prevention Act, there is an Indecent Representation of Women Prohibition Act, Sati, Protection of Women from Domestic Violence, Sexual Harassment at Workplace, Criminal Law, Indian Penal Code, Indian Evidence Act. Now, other than the POSH Committee Act, which is the Sexual Harassment of Women at Workplace, there isn't anything related to workers in the workplace. Everything else is more relevant to their home setting, and there's nothing related to migrant female workers. So you can well appreciate the fact that as to why it is really significant and important that something specific is legislated, something specific is kind of brought about that talks about female migrant workers and all their rights and privileges and compulsory registrations. And NCW has also been speaking about this, but I just thought I'll also show this perspective to you as we speak. Again, this is the Labor Department of Tamil Nadu's website, and the drop-down menu that you see on your screen is the statistics that are available in the website. And you can see it's about strikes and lockout, disputes and various claims and appeals. Again, no statistics on the actual number of female migrant workers or anything that is specifically pertinent to women. So nowhere is the women workforce seen or shown separately, and the statistics being kind of put there on the public domain. So this again, as I said, calls for action, and as NGOs, as advocates of this particular cause and issue, this is something for us to be working with the government and bringing their attention to. So which are the industries where migrant female laborers predominantly work? And I would say all industries, but however, based on statistics that are available, the list that you see on your screen are the industries where they are mostly working. So like agriculture, textiles, construction and bricklines, IT and call centers, healthcare, retail, beauty parlor and other service industries, restaurants, hotels, domestic health, and small vendors. So this is based upon the statistics that are there, and then of course they are there everywhere. So this is not a restrictive list, but more of a indicative list. Right. Now we come to the specific point of discussion. So far we have been talking about general challenges, general legal environment, general industrial environment where these migrant workers are operating. Now, if we have to look at the specific issue of the COVID pandemic, what did we see? We saw the huge exodus of female migrant workers of various sectors who went back to their hometowns with their families. At the same time, we also saw a huge inflow of frontline workers to the cities or to the places where there was a high incidence of COVID-19. So as far as healthcare workers, police personnel, sanitary workers, all these people were drawn from different parts of the states to the places where there was a high incidence of COVID. So there was also an exodus and there was an inflow. And there was also a third scenario, which I have not put in this slide, but it comes in another slide, wherein you would find that there were people, there were single migrant laborers who stayed wherever they were staying. They did not go back, nor did they kind of, accompany families. Those were individuals who were working alone and staying in hostels or staying in dormitories and working in the cities. They did not go back. So that was another aspect also which needed to be considered. So you would find that overall fall in labor, and this is not pertinent to just migrant laborers, this is overall fall in labor across India, came down from 400 million in March 2020 to 280 million in April 2020. So if this has been the case for the whole of India, you can well imagine how it has affected the migrant worker situation. So November 2020, 13% of women are neither in the workforce nor are they looking for a job. Again, this is all India, all laborers statistics. Right. So now, since our topic is about NGOs and industries, now what did the NGOs do during COVID-19? They helped in transportation of the migrant workers. Although there was a Supreme Court ruling that everything should be free and the migrant workers should be given buses and trains should be available to take them back without fares, the initial exodus in kind of panic was chaotic, and it was only the NGOs that worked with the migrant workers in ensuring a safe transportation to their home locations. They gave them food, they gave them relief materials, both while on transit and also after they had reached their locations. And whoever was left behind was also cared for by the NGOs during the lockdown period. Again, they gave them masks, they gave them other, sanitizers, those things were all provided. We as Sanitation First, the organization that I head, were working through the COVID pandemic with the migrant workers in providing, wash services in the various locations, in the corona wards in government hospitals. We provided in wherever they had been quarantined, the places where they were staying, all these places we gave wash services to them, like, portable toilets, hand wash stations, contactless hand wash stations, hygiene material, all that was provided to them. So apart from this, the NGOs also supported those who were affected by COVID. So if a person was affected by COVID, they took care of the persons, taking them to the hospital for testing, taking them for admissions and other things, supporting their families in whatever requirements they needed. If the key person, the earning member, was away in the hospital, in case somebody passed on, they helped with the cremation. They also supported deliveries. We would have seen a lot of videos and news about pregnant women who were delivering on the way as they were going back to their hometowns. And they were also helped when there were cases of domestic and sexual abuse, which rampantly increased during the lockdown period. Okay, so what happened to these migrant workers who went back to their residences? First of all, they lost food security, because while they were in their location where they were working, at least if the industries were not providing them food, they had some kind of surety of livelihood whereby they could provide for themselves, but that was lost. NCRB, the National Crime Report Bureau, mentioned that there was a 600% increase in domestic violence. Now, this is something that, the number is absolutely alarming, 600% increase. And this was not just in the, it was not just restricted to the villages or restricted to the lower quadrant of the economy, but it was rampant across the board. The women were forced to accept poor work conditions and meager wages. Now, what happened was, immediately the agents got in touch with them, gave them some advance amount to block their time to collect them back once the lockdown got over. They had no option but to accept this, and then they had to go back. Else, whatever work was available in the place where they were stationed, they had to accept those poor work conditions and whatever meager wages were available to them. Complete disruption in routine healthcare and reproductive health services, because they had no access to any of this. They lost the childcare support in Anganwadis, which they got in the places where they were working, because most of the Anganwadis were closed. They did not get nutrition for the children because schools were closed. It took some time for schools to give the rations, but before that, there was quite a chunk of time where the midday meals were not available. One problem we found across the board, because we work in WASH, was there was a huge scarcity of menstrual hygiene products, because children, girls used to get the napkins in school and women used to have some money to purchase these napkins. Most of them had to go back to cloth because they didn't have the money to do this. They had a challenge to keep children in school because all the government schools were closed. There was no online education. They had to take up a compromise in the housing and water sanitation conditions. There was no employment, no training. They could not come back immediately. Even now, only about 30% of the employees have returned and taken up the jobs. The remaining are still struggling. There was no financial resources to resume business. The one huge portion of the migrant workers were people who came to the cities or came to the nearby towns, and there were small vendors who were selling, they were roadside vendors, or they had small shops, pavement shops. These people did not even have the working capital available to them to resume their business and continue their business. There was distressed sale of assets, there was loans, there were debts, and not to say alcoholism. In fact, alcoholism, I want to linger on that for a moment. Yes, the liquor shops were closed across the board. And then at one point where, this alcohol was being sold in black market in different places, once the shops opened in certain locations, I think Chennai, where I live, was the last place where the wine shops were opened. And during that time, because the traffic was closed in most of the roads in Madras, the leveling of potholes and then the repairing of stormwater drains and all was going on. And it was really difficult for them to get laborers, because most of the workers, what they would do, women and men both, would go all the way up to Tiruvallur, where the wine shops would be open. So they would take the Annakuda or the the Parambakuda and go on two-wheelers with their sons or husband or brother or somebody. And then the women would stand in the queue in the wine shops and collect all the bottles, because apparently they had a preference in the lines, like how you would go see in a cinema theater in the previous days, where if a woman went and stood in the counter, then she would be allowed to collect the tickets, even if the men are waiting. So the women used this privilege to collect the bottles, brought them back, and sold them at twice, thrice, even 4 times the cost. So this gave them money to kind of keep their families running. So they were not willing to take up any other employment, which would have probably given them less money. So in a way, because of these shortcuts and because the money that came through it, alcoholism continued to flow, which led to the increase in domestic violence. Now, what about the people who are working from home? As I said, not everybody was a laborer who went back and tried to find labor. There were many people who had to go back to their home settings and work from home. And what happened to them? The first thing was an increase in health issues. So the women, there was this big study where it spoke about a large number of women coming up with health issues because they did not have the money to buy LPG, or they probably did not have LPG back in their hometowns, where they went back and they had gone back to resorting to firewood, and so they had breathing difficulties and so on. Complete collapse of work-life balance. And this is something irrespective of whether they are in the city or in the village, migrant worker or otherwise. Every single woman has experienced this in the lockdown period. And in case there are women in the group who have been going through this, I'm sure they would appreciate, because the entire family is working from home. And so apart from your working from home, you also have to manage taking care of their requirements and needs right from the morning till the night. And so there's complete collapse of work-life balance. There's been an increase in the expenditure in working. So previously, you would go into an office and work, wherein other than your transportation expenses and food expenses, there won't be any expenses in the working itself. Whereas here, you have to either get data on your phone, or you have to get an internet connection, or you have to, get your larger telephone bill. So all these things, which not every case is paying for, there has been a higher expenditure in working. Increase in domestic violence and abuse, we have already seen. For people who are working from home, the migrant laborers, no baby care or senior care support is available. So they have to juggle that as well. Studies show that the domestic responsibilities have gone up from 5.3 hours a day when prior to the lockdown to 6.79 hours per day. On paper, it will look just like an increase of a little over an hour and a half. But then if you had to look at it from the stress levels and the physical exertion levels that the women have to go through, you would find, you would understand how it could kind of, affect their mental health and well-being, or even their physical health. Inability to support the online education of the children. So even for those people whose children were, studying in private schools, if they went back to their home locations, there they could probably be suffering from lack of bandwidth. They would not have multiple phones, multiple computers. You would see used laptops that were being sold at 3,000 and 4,000 rupees, Windows XP processor laptops from 10 years or 8 years old. Those were being sold at 20,000 and 25,000, and people were even pledging their thalis to buy that for their children so that the children could continue with their online education in schools. And then, of course, forced to participate in additional labor activities, whatever was their family occupation, other than continuing their work, whatever they were working from home, whatever their day jobs were. They also had to support the families, because now they went back to their in-laws or to their parents, where they were already carrying out agriculture or any other family occupation, and these people had to participate in that as well. Now, I said, we never saw when the huge exodus happened on TV, on newspapers, even when we physically saw people moving in groups to their hometowns, there were very few single women who went back to their families. Now, there could be multiple reasons for this. Probably the families felt it was not safe for the girls to go back all by themselves, so they stayed with friends, they stayed with colleagues, or they kind of hung out with whatever was available to them. And what happened to these people was they had to work longer working hours with a huge cut in salaries. Even now, this has not come back up. Even in IT companies, this happened, where most people had to take cuts in salaries. Mainly in FMCGs, people who are working in the service industries, they had to accept whatever task was available to them, or whatever was the rate in which they were rehired. They missed out on all the COVID-19 relief schemes, because at least people who went back were given, dry rations, were given 1,000 rupees in case they were a registered migrant worker. Now, these people did not get that as well because they didn't go back. The living expenditure definitely had gone up. All of us know what were the prices of vegetables, or even the other expenses, how high they had become during and immediately after the lockdown. They had to live wherever it was possible for them to live with the means that they had. The stress levels and the mental well-being was definitely affected, because one, they hadn't seen their families in a very long time. Second is they had all these compromises that was piling upon them. And home-based migrant workers. Now, this is another complete, people who are doing piece jobs, or people who are doing kind of in the agarbatti rolling, or handicrafts, people who used to kind of stitch certain pieces and give it back in bulk. All these people during lockdown and after lockdown, they had to work for 8 to 10 hours, and they were only getting paid something like 10 or 15 rupees a day, which you can completely agree that they would have absolutely not been adequate for them to take care of any expenses. Now, the fourth type of female migrant worker category are those people who were frontline workers, the inbound migrants who came to those places where there was a rampant increase in the COVID-19 cases. So you would see from the statistics that are available that 70% of frontline workers and 88.9% of nurses are women. So what happened to them? They had to work very long working hours. There was a huge inflow of patients in all the hospitals, be it government hospitals or be it private hospitals. Long shifts, very insensitive working conditions, because they had to wear the PPE kits for 8 hours or 10 hours, within which they would be sweating. They could not, because of the mask, you would have seen a lot of pictures on social media about marks that they had on their faces because of the N95 mask pressing on their skin. Menstruating women, hygiene and menstruation would have been a huge challenge for the frontline workers, because they would not have an opportunity to remove the PPE kit kit and change their napkins, which means they were bleeding into their napkins for 8 to 10 hours at a stretch, which would affect them psychologically and also physically, and gave them a lot of health issues because of that. People were dying on their hands every day. So you watch a person dying in the road as you're passing by, that affects you for 3-4 days. Now what would have happened to these people who were to see, like, cases being brought in every day where people were dying? So that itself was affecting their mental health, and there was absolutely no time or opportunity for them to be counseled. There were several occupational health hazards, like PPE kits were not available mainly to sanitation workers. Insurance was not available to everyone across the board. So, talk about every single hazard that is there. The frontline workers were going through that. Poor pay in many sectors, they were getting very poor pay, like sanitation, because people were brought from everywhere, and these guys were deployed in making that tagaram and sealing up all the houses if a person was detected with COVID, putting the bleaching powder. In fact, we used to give food and tea and money to the health workers who were working here, because they are mostly very poorly paid, and they had to work around the clock because every street had cases that they had to go and attend to. They had to get their food, they had to get them whatever they required at home. So it was like a thankless situation. They had to stay wherever they were given housing. There were doctors and nurses who stayed in their vehicles for 10 to 15 days because they couldn't go back to their families, nor was there a space available in the dormitories for them to stay. The most significant challenge that was faced by these people was stigma and discrimination. The house owners were asking them to vacate because they were working with COVID patients. Doctors and nurses did not have neighbors coming and playing with their children because they were affected, that they thought that they would be affected by COVID. So many ways in which stigma and discrimination affected them. So all these challenges had to be faced by these people. Now, what was happening behind the scenes? A lot of things we have already touched upon, so I will go quickly through this. Single migrant women, as I had mentioned in the previous slide, who stayed back, had to face a lot of challenges. Industries, when after May, when the industry started opening up in phases, what they did was, the first batch of people that they hired was the able-bodied young women. They did not take the older women, they did not take women with responsibilities, health conditions, because they felt this younger group of women could work for as long as it was required, and they could work at any pay that was offered to them, because the families would be fine with that and the women would be fine with that. Also, when the SOPs were released, the mandate that allowed longer working hours with employee consent, it's a completely misguiding concept, because what is employee consent? I mean, in these situations where the people are dependent on their survival for the money that they get from their jobs, the employee consent actually means nothing. They do not have the liberty or the freedom of choice and have to go with whatever is available. Particularly women. Women are the caregivers. Women are the guardians of the entire family, and anything that will bring food to the table for their parents or for the spouse or for the children, they would be happy doing that, even if it means sacrificing their own well-being in the process. As I had mentioned earlier, the agents had already booked the migrant workers by giving them advances, which was useful to them during the lockdown period, but made them bound to go and accept whatever work conditions were available to them. So efforts definitely were on behind the scenes to keep women trapped in the vicious circle of bonded labor. Although, in good times, the government has been working very hard. Organizations and NGOs have been advocating against this in a very strong manner. Mental health and well-being, we all agree, was thrown out of the window. And as I mentioned, women were more gullible to accept longer hours to stay in the jobs for their families. So what is the gap in the policy framework? None of the labor laws, as I had mentioned, have specific provisions for female migrant workers, no official statistics. SOPs did not have any guidelines or criteria for the migrant workers because although migrant workers were in the radar of every media channel, every newspaper for the best part of the lockdown. Despite that, when the SOPs came for reopening of industries, absolutely no guidelines or criteria for migrant workers. The registration process, once the people were coming back to take up their jobs, it is not friendly at all, because if they have to go and register in the police station, it is like in Tamil we would say kaasu koduthu suniyam, because one women would not be comfortable to go to a police station to register themselves, and this would be like even otherwise migrants are pulled up for any crime that happens in that area, and this would be like they themselves are kind of adding to it. So if a friendly registration process for migrants was done, where they could probably go to the panchayat or go to the local body and then register themselves, or to a welfare department and register themselves, then that is something that they would be able to do. And domestic help, we really don't know. There were households where people paid their domestic help wages and asked them to stay at home during the lockdown period, but there were almost 60% who did not pay any wages, did not bother about what their domestic help was doing or surviving when the lockdown was going on. Now, as I had mentioned, the National Commission for Women has been recommending for a legal review of the Interstate Migrant Workers Act 1979 to bring more impetus, to bring more focus to the issues that are being faced by the female migrant workers. They have been asking for an integrated portal for female migrant workers. There are various unorganized labor departments which look into the welfare of workers in each of those departments, but they want to bring female migrant workers under one umbrella and have an integrated portal where women, irrespective of the sector that they are working in, or even if they were to move between sectors, will be able to register themselves and be a beneficiary of all the government welfare schemes. Again, they are emphasizing on the implementation of the workplace sexual harassment law. Now, the POSH committees or the internal complaints committee is something that is a good initiative. It's a good beginning to make sure that there is a process for complaints that are against women. But then all of us know there are so many loopholes, or there's so many interpretations of this. The ICCs are not functional at all times. The documentation of all the cases that have been raised is not there. And more importantly, the intent. It is not, see, harassment, even recently you would have seen in the newspapers or even in the news a couple of days ago about a court ruling that touching a 12-year-old girl, touching her breasts over her clothes cannot be termed as harassment. This is the most absurd thing that I've ever heard, because harassment is not the intent of the abuser. It is how the abused feels. If somebody feels uncomfortable merely by another person looking at them, then that can be defined as harassment. And I don't think, the judiciary still has a long way to go to understand this. And so how can we blame industries for not understanding these interpretations? So documentation of all the cases, documentation of all the meetings that the ICCs have had, the different types of cases that have been brought up, what has been the ruling. Of course, when we say harassment, we don't want to restrict it just to women. If there have been cases where female workers have harassed men, fine, welcome, gender parity, put it down, document it, and then we can have a case for talking about sexual harassment laws and implementation of workplace sexual harassment laws. And then definitely the women domestic help, the huge sector of domestic workers who are mostly migrant female laborers, to be brought under the purview of the Act. Making sure that equal work and equal pay is a reality, and it is not just something that is there on paper. Bringing middlemen under scrutiny, as I mentioned, agents to be completely brought under law, their scope of work to be defined, and they made accountable. The role of labor inspectors to be tightened. When I say tightened, I think they should be empowered more. So it is not the question of them not delivering on their jobs, but to empower them more to be the guardians or the custodians of sustaining well-being in the of the migrant female workers in the industries. And all the industries must be mandated to keep a list of women and girls who are employed by them with all the welfare measures that they have been provided, irrespective of whether they were employed through a contractor or employed through an agent. And the Occupational Safety, Health and Working Conditions Code 2019, this was supposed to have all these clauses that came into it. Everything that I've spoken about in this slide was supposed to be part of the Occupational Safety, Health and Working Conditions Code of 2019, which is still sitting in the parliament to be enacted. So a fast enactment of this code will make sure that all these loopholes, all these gaps that are there in the law are tightened up, and the women have kind of more smooth environment where they can sustain their well-being. Right, there are about 18 unorganized sector welfare boards, as I had mentioned in the previous slide, wherein if a migrant worker registers themselves, they get social security, they get accident insurance, life insurance, medical facilities, and they are also given, during the lockdown, they were given cash dole and dry rations, and industries are only expected to make a very minimal contribution for registered members at 200 rupees per person per annum. And after Corona lockdown, an online registration portal has also been created for these unorganized sector welfare boards. But then, in order to register themselves, they need all these a list of enumeration documentation. They need a letter from the trade union leader or the general secretary or from the panchayat or from the contractor. So all these things are required, and then they have to be verified, and then that person will be registered. So when this process is so elongated and multiple stakeholders are involved, anyone in India can understand what would be the process and how friendly or how economical it will be for the person to get themselves registered, particularly women, or in this case, even single women for that matter. Of course, if there is a registered female migrant worker, hoping everything goes well and we have a more conducive, more customer-friendly registration process, they can get dormitories, free dormitories. If they are staying alone, they get Anganwadi support for the children. And as I had mentioned, medical assistance and insurance assistance. But, once the process is smoothened and streamlined, these would be available to many, many more people. So when we talk about well-being measures, we say industries should sustain the well-being of female migrant workers. So what is it that we are talking about here? So first of all, compassionate and dignified treatment. The female migrant worker should be treated at par with any other officer or any other employee in that organization. So definitely there needs to be a change in mindset when it comes to appreciating and acknowledging the manner in which they are to be treated. They should also be given the same working hours and the same pay as their counterparts in the organization who are regular employees. And then there needs to be prevention of exploitation, prevention of sexual harassment and discrimination in the organization. They should be in the living dormitories as well as in the workplace. They should have restrooms, they should have water, drinking water, safe drinking water, and hygiene absorbance should also be provided to them. Wherever possible, they should be given opportunities of continuing their education and training, because that will then motivate them better to stay and grow with the organization. There should be a modality where they can separate from the industry with ease. We see in many of these cases, there is either forced labor or bonded labor, especially in the lower rungs of the organizations. So that should be stopped, and they should be able to move freely within the economy between jobs and between industries. And definitely they should be provided linkages with government schemes. Right. So what is the expected role of NGOs after COVID? Now, in the previous slide, we saw that they gave food, they gave transportation, took care of their health, everything. So they have been more of a grantor. But have all NGOs worked in an advocacy role to advocate for the rights and privileges of the redesign themselves and move to an advocacy role in order to ensure that these rights and privileges become a reality and become permanent and sustainable for these women. The NGOs should help in creating a panchayat level registry of migrant female workers, so that there is reliable data available and is constantly updated at all times about the migrant female workers. As I had mentioned in the previous slide, they should work with female-centric organizations to advocate for a welfare board for female migrant workers, get them registered, get ID cards so that they can open bank accounts, or they will be able to take loans in case they are small vendors, or even for their own, family requirements. Connect them to the ration shops and connect them to ICDS. One nation, one ration is a fantastic kind of catchword, and we think just because somebody has a ration card in their home city, they will be able to come to another city and then collect their ration from the ration shops. But in reality, it doesn't work like that. The ration shop would only get that much ration for the number of people who are registered in that shop. Merely showing a ration card is not going to help the vendor to give the food to this person. So unless there is this seamless registration and seamless allocation and connection of these workers to the government schemes, the people can they can have a ration card but they would not be able to use it. Similarly, health screening and links to the government insurance schemes, the employee state insurance, hospitals and so on, so that they are able to practice or they have good health seeking behavior and good health. Advocate for fair and equal wages and reasonable working hours. A single window helpline to register claims and cases and appeals for migrant female laborers. Now, they have to run from pillar to post to different departments in case they have a query or a claim. Whereas if these are brought by the NGOs under a single window, and the NGOs can be this bridge to connect the various departments with the migrant workers and then have their claims or their issues sorted, then that would be a big help as far as the female migrant workers are concerned. For those people who have not returned to the employment stream, if they can be included in the rural in skilling through the National Skill Development Corporation or the Sector Skills Council or the Deen Dayal Upadhyaya Gramin Kaushal Yojana, so that they are able to either get a skilled position or they're able to do some, they are able to become self-employed. They could set up vigilance committees to prevent exploitation and bonded labor. Basically, they could turn into these whistleblowers to bring to the attention of the government and to the media about exploitation and bonded labor. They could work with industries. I mean, we lay a lot of emphasis on what the industry should do. But unless and until the industries are trained to and made sensitized to understand what it means to provide reasonable work conditions, equitable pay, and well-being measures, the well-being will not be sustainable. So NGOs can take on the role of sensitizing industries. They could activate the internal complaints committee and make them function and document all the cases recorded. And in order to do all this, they could appeal to CSR funding opportunities that are available to address all these issues and make sure that they are done, because NGOs obviously need money to do all this work, and that money could come from CSR grants. What are the expectations from industries? Now, industries, the first point, as I had mentioned, treat migrant female workers with dignity and provide them with fair and equitable work conditions and pay, provide for all the health and safety requirements, ensure that all the complete workforce is redeployed after lockdown. Now, this is another challenge that is emerging in the industries because, as I mentioned, they are picking up younger able-bodied people and do not want to re-employ older people or people with health conditions. Now, that should not be the case. As a welfare measure for sustaining the welfare of female migrant workers, they should redeploy, re-employ everybody who had been let go and make sure that their health and safety is taken care of. They should also provide non-formal education and training opportunities for better engagement and for better growth within the organization. They should support for registration with the welfare boards through giving the letters that are required through the trade unions wherever these workers are working in an organized sector. And they could also deploy, because now industries in many cases, I would say 80% of the cases, want to do direct implementation of CSR programs. They do not want to give the money to NGOs to run the CSR programs on their behalf. If that is the case, then they could make use of the CSR funds to provide various welfare measures like training, skilling, giving them better water and sanitation conditions, better living quarters, All these things, health facilities, all these can be done as welfare measures, ongoing welfare measures, because one-time grant will not come under the CSR umbrella. So an ongoing welfare measures for these workers can be done by the industries also using the CSR funds. Together, I'm confident that we can sustain the well-being of female migrant workers post-COVID if industries, NGOs, academicians, and budding development professionals such as yourself in the audience, as well as the migrant workers themselves, understand their rights and privileges of the female migrant workers, and then come together as a as a society to sustain the well-being of this group. So I'm at the end of my presentation. Thank you so much for listening carefully. I see a lot of questions. So is someone going to be calling the questions out?
Yes, madam. So
Okay, thank you.
it was a
Can I just
very
drink?
wonderful session.
Can I just drink?
Yeah, please.
Thank you.
Yeah, you should. Yes. So very elaborate presentation and a lot of insights you gave through this presentation, and it shows how much you are involved into the cause of this migration and their empowerment. Running short of time, I would like to ask some important 2 or 3 questions maximum.
Sure.
One is how far the recently amended Maternity Benefit Act is welfaring this migrant women. That's what is the question.
It's a very good question, but then we do not have adequate data to show if every single organization has started giving these benefits. Definitely, those workers who are in the organized sector are getting these benefits of 6 months of paid leave and then surety of employment when they come back. Of course, they would have, again, now, because of this new government regulation that everybody, irrespective of where they are having their deliveries, must be registered with the government. Make sure that every single pregnant woman is kind of enlisted, and the government is connecting them into the welfare schemes by providing them with nutrition. And once the baby comes, they also give them all the kits. Unless and until you're registered with the government, you can't even get the birth certificate of the child when the child is born. So this is working well for those who are the organized sector. As far as the unorganized sector is concerned, the yawning gap is the lack of data. So because the first loophole that the industry states is 50, only if there are 50 full-time employees that are available and they have worked for 180 days, would they be eligible to claim maternity benefits. So very often, this becomes that, it becomes that gap in the law where industries don't provide the maternity benefits as they should be provided. But over and above that, if the person has come through an agent, at least through a contractor, if the contractor has employed 50 women, then the contractor is bound to give them that maternity benefit. But if that person has come through an agent, and the law says, as if the person comes through an agent, then neither the industry nor the agent is responsible. Then, it's anybody's guess if the industry is actually giving them that benefit. If the industry has a very humane, compassionate outlook, then probably yes. Otherwise, in most cases, maybe no. So maybe it would mean that the woman drops off the employment stream, and only gets back either when she finds someone to take care of her baby, or when she is able to come back in a manner that there is a daycare center or an Anganwadi that's available where she can safely leave the child. But then the Anganwadi story is an entirely different story. Because we are short of time, I don't want to go into that, because we build a lot of toilets in Anganwadis. And when we go there, they say that, in most toilets, even in Chennai city, there are no, most Anganwadis don't have toilets. And they say if the child wants to actually pass motion, she is sent with an assistant to her own house to go and pass motion, because there is no provision in the Anganwadi center. Imagine taking a child, like if a small child of 2 or 3 years, multiple times, and there's nobody at home, and it's anybody's guess about what is the well-being that is being offered. Yeah.
Yes, madam. There are a few more questions, but since we are running short of time,
Yeah.
The next person is waiting.
Sure.
I would probably people can share their questions to us, and we can share it with you.
Yes.
If there is another occasion, you can address those the questions.
Definitely.
So at the outset, I would like to sincerely express my gratitude and thanks to you, madam, for accepting our invitation. It was very easy to get your acceptance, and you said immediately okay. And the session was really tremendous with a lot of commitment. You have prepared, and you shared all your experience, how you work with migrants, and all the very best for your career. Hope to get in touch with you for the future programs, madam. Thanks a lot. Thank you so
Thank you
much.
so much. I would also like to thank all of you for patiently listening, and good luck for the remainder of the sessions. Thank you so much.
Thank you, ma'am. I now request our beloved Assistant Professor, Mrs. Lisa Ilango, ma'am, to introduce the speaker for the fourth session.
Am I audible, Anne? Am I audible?
Yes, ma'am. Yes, ma'am.
Okay. So, good afternoon to everyone online. I'd like to start by appreciating and wishing Dr. Arakiraj and his team for running the show successfully with all eminent speakers and very great participants. And here I am to introduce a very good speaker. I'd like to start it with an quote. If your actions inspire others to dream, learn more, do more, and become more, you're a leader, says John Quincy Adams. So, as the quote says, here I am to introduce a very inspiring leader, a women leader, especially Miss Lata from Sacred Heart College. She is working as a college counselor, Tirupattur. Miss Lata has completed her MSW and MPhil in Sacred Heart College, and she has specialized in youth development. And she is currently doing her PhD at Bharatiyar University, Coimbatore. When we talk about her work experience, she has a very long work experience in counseling, and nearly 17 years of experience she has in counseling. She started her work career in CMC Vellore. She was working there for more than 4 years as associate research officer. And then she was working as a medico-social worker in St. John's Medical College and Hospital, Bangalore. Then she moved on to Malaysia, where she was working as a student counselor for more than 2 years. And then she was working as a liver transplant coordinator in Chettinad Health City, Chennai. And then she moved on to her host institution, Sacred Heart College, Tirupattur. And she is now currently working from then as assistant professor in the Department of Counseling and Psychology. And she is also serving as a college counselor, and her specialization and work area is related to pediatric counseling, adolescent counseling, family counseling, and she is also an adolescent trainer. So I'm very proud and privileged to introduce ma'am to all the participants, and I welcome ma'am to share about the coping skills for migrant women workers. And the time starts. Let's listen to Lata ma'am.
Madam, your PPT is visible. You can check here.
Yeah.
Yeah, it's fine. It's fine.
Am I
Your
audible?
audio is fine. Yes, yes, very much.
Yeah. Okay. Can you? Just 1 minute. Yeah. Okay. So good afternoon. Thank you, Lisa ma'am, for your introduction. So I think I have only half an hour of time. And today, basically, I think uh, ma'am, she has covered all the legal law aspects and also human rights. So today I'll be just sharing my experience as a counselor. And basically I'll be talking more about the psychological aspects of the psychological issues migrant women workers generally face, and what can be done uh, as a community or as a institution or individually, how migrant women workers can take care of their psychological aspects. So I think I'll go to the slide. So first of all, I think by today, by like already yesterday also people are talking about migration. So these are different types of migration, where you all, I think you might know that internal migration, external migrations, like how women basically move from one state to the other, or it is even in a state from one village to the other is also considered as migration. So these are the different types of migration, how women are either they are forced or by their will and wish they move to another state, country, or another village. So if you ask about the reasons for migration, we always say that there are two factors. One is push factors and another one is pull factors. Push factors are basically when we say it is basically negative. It is because they had some problems. They move from one place to the other, or they migrate from one area to the other. So when you say push factors, basically all these push factors, they are interlinked with the psychological problems women generally face. So when we say push factors, these are basically the problems. And because of all these reasons, women generally go from one place to the other. So maybe they might move because of lack of services, or sometimes ma'am also spoke about marriage. Even when a woman gets married, maybe for example, if she's in Tamil Nadu and she got married and she went to Bangalore, or Karnataka or Kerala, so that also is treated as migration. Lack of safety, sometimes in some states or some countries safety is an issue, so people travel, especially women, they travel from one place to the other. And high crime rates also is a major cause. Or sometimes if there is a crop failure, they may own lands, they may be having their own land, or they may be daily wage or coolie wage, maybe they're earning money by going for coolie work. So if they have any financial difficulties also, they move from one place to the other, from one state to the other state. For example, now like in Tamil Nadu, we also can see a lot of women who have migrated from North India, especially Bihar, Patna, because of financial reasons. They have moved to Tamil Nadu and they come here. They live in unhygienic places, and that itself leads to a lot of problems, especially social problems. So these social problems are generally linked to their psychological issues. So crop failure, drought, flooding, poverty, war also can be a cause for women to move from one state to the other, or one country to the other. So pull factors, these are basically something good, they move from one place to the other. It can be employment, or they want more wealth, so they move from one place to the other. Or if services are not good, so they move from their village or from one city to the other. Even the climate is also a reason, safer or less crime in a particular place. Or if they have fertile land, so for agriculture, they move from one place to the other. Or sometimes lower risk of natural hazards. Like a lot of people, even women, have migrated from Andaman because of during the tsunami period. Even people from Kanyakumari, they have moved into the southern parts, like North Tamil Nadu. So these are some of the something good, they move from one place to the other. So basically, women move as migrant workers. Either it is a push factor or it is a pull factor. So, so when it is, whether it is pull factor or push factor, if a woman is not prepared psychologically, then the problem arises. So that is what today actually I'm going to talk about. During my counseling experience, I have even met women who have migrated from one place to the other. It's not only, when we talk about migration, doesn't mean that only because of poverty women move. We also know that for educational purpose, or they're well educated, they go abroad for good opportunities. So even whether it is pull or push factors, women face a lot of mental health issues. So this is the basically common mental health issue which women, migrant workers face. And these have been researched, and the major thing faced by these migrant women is post-traumatic stress disorder. So that means, as a counselor, I always say that prevention is better than cure, especially when you talk about mental health. So before somebody migrates, if they are psychologically prepared, then their coping is very easy. So preparation is always better. So a lot of women, when they go from one place to the other, maybe they may undergo abuse. Sometimes they may feel isolated, rejected. Racism is also there. So because of that, and also physical abuse is there when they go for work. It can be a colleague, it can be a broker who has brought them there. So if they are, before traveling from one place to the other, if they are actually, given good psychological support, or they are being, they have been empowered to have a good psychological health, then it is very easy for them to cope up. So the major issue when you think about mental health issues is the post-traumatic stress disorder. A lot of migrant women have complained about their traumatic experiences, and they have, that has led them to post-traumatic stress disorder, major depressive disorders. They have a lot of anxiety, adjustment disorder, and also substance abuse. Why substance abuse? Yeah, there are a lot of women who even travel from India to abroad. Not only, it is not that only men get addicted to substance, even women do get addicted to substance. So when you ask, when you say migrant workers, especially women, the major mental health issues or hazards are these, whatever I have put on the slide. So today, basically, I'll be talking about like how to cope up with all these. Now, these are some of the factors for common mental health disorders. First is age. So age is a major, reason for women to have mental health disorders. They say that most of the women who are in their middle age, say when they are young women and also old age women, especially old age women, migrant workers, they complain mostly of depression due to a lot of other things, and they, especially physically, they are not able to, work, or they are not, when they are not given job, or when they are thrown out of job because of their old age, they go into depression. And also when they go back to their hometown, they don't have money. So basically, age is a major factor of women to come up with mental health disorders. Next thing is sex. So when you say sex, the statistic shows that it is more of women migrant workers have a lot of mental health disorders. So we'll be talking about like what are the reasons later. Another thing is their marital status, especially women who are widowed, divorced, and separated. So mental status, the marital status also is a major reason for the mental health disorder, uh, especially the women who are widowed, divorced, and separated. So it is basically the single women, okay, those who are migrating from one place to the other, either they are widowed, divorced, or separated, and when they go live in in another country or another state, they face a lot of mental health issues. Next is the region of origin. So the statistics says that Irish, Pakistani, and Indian women, they have a lot of mental health issues when they migrate from one place to the other. So India is also there. Maybe the reason is our women are not empowered much. and also their coping mechanism, especially when it comes to psychological problems, they are not able to face it. So their origin also matters. Next is the educational level. How much educated you are, that much empowered you are. That is what, as a counselor, I also believe. So mostly when when they're not educated, they don't have much knowledge about their rights and the laws which are there to support them. So education also plays a very important role. If women are educated and then they migrate, maybe the coping mechanisms are better than the women who are actually not educated. Again, talking about socio-economic status, women who are from a very poor background, due to their economic situations, uh, even the economic status itself is it's a kind of an empowerment, what I feel as a counselor. So the women who are very poor are prone to have more issues than the women who are actually economically stable and they're going from one place to the other. So when I say socioeconomic and educational level, language proficiency is also there. So when women migrate from one place to the other, the major issue what they have is language. And once when they are not comfortable with the language, they basically isolate themselves. They don't even to have a medical support, they don't go and approach, or they don't talk to people. So there comes this, all these things basically will lead them to have a lot of stress. If they have any psychological problems, they may not go and share. So language proficiency, if they are not proficient with the local language or the country where they're going, they also have a lot of issues, coping with the situation of the new, the basically the cultural clash will be there. So that also brings mental health issues to women. So main thing is psychological torture. So there are a lot of women who are, when they go as migrant workers, especially when they are taken by these agents, it's not legally done. Rather, maybe the family might have had some financial difficulties, or they might have taken some loan, and the family is not able to pay. So these brokers, they will take these women, and even young girls are taken by these agents, and they promise that they will give them a good job. But they are taken into places where we also had a situation where two women were taken from North India. They were brought to Karnataka, and they were kept there. They had two kids. These women were on regular basis, they were physically tortured and raped. So when we say physical torture, imagine the trauma what they are undergoing. So ma'am said, no, she spoke about touching the breast. That is not, when somebody is wearing a cloth and touching the breast is not considered as, harassment or sexual harassment. Same thing happens here. Like when you say physical torture, again, it is basically not only the physical hurt what a person is going to get, it is more deeper, it is more psychological. Okay, that is how when they go back home, they face post-traumatic stress disorder, and it is seriously very difficult for the counselors or the people who are in the helping process to bring them into a normal life. So physical harassment or physical torture given to these women is basically a major cause for psychological disorders among these women. Okay, next is witnessing somebody being tortured. So it is like you tortured is something else than you witnessing somebody being tortured. So there are a lot of situations where these migrant women, they were taken into groups, okay, and even they witnessed in front of their own eyes, women being sexually abused or being raped. So that again is another factor where you become a witness, watch somebody being tortured, and that itself creates that fear and phobia inside you. Okay, in my counseling experience also, I also had a chance to meet some migrant women who were actually trafficked in the name of giving job. They were trafficked. They were taken to Mumbai. They were sold there just for 700 rupees per person. Okay, these brokers took them to Bombay and they were sold in red light areas. So when they were rescued and brought to the counseling center, when they shared their experience, it was like it was seriously a very painful situation to hear these women tell their stories. And most of the women, say 17 were brought, and around no 10 to 12 women were actually taken by known people and sold. And they said that it was fear of human. No, now when they were sharing their experience, they said, now we are in a situation that we even when we see a human, no, we have that fear. When we see human, especially when we see males, now we have aversion towards male. And they said that they have witnessed a lot of women being raped in front of them. So that fear is still inside them. So these migrant women not only are being abused by themselves, rather they also witness other people being tortured or abused. That also remains as a trauma. And next is isolation. So I already told you that language is the biggest barrier. Not only language, culture, the culture itself is different. They may go from rural area to urban areas. They are not able to cope up with their way of life or even the food habits. And because they don't know the language, especially people, a common language is English. Most of the people, women are not that much, if they're not educated, they are not, they even cannot communicate. So if they are into a problem also, they're not able to express it to anybody. So that causes isolation, and isolation automatically will lead to stress, and later it will lead to some psychiatric or psychological disorder. So if women are empowered, so my point is, I just want to tell you all that if psychologically they are prepared, so not only the physically being prepared, rather psychologically being prepared. So even if it is a small child, even in schools or colleges, we have to empower our children, especially women, because 80% of women are trafficked and they are sold into sex trade. So there we have to basically empower girl child. Not only girl child, even male child has to be empowered when it comes to being trafficked. So basically, the psychological preparation is very important. Their self-esteem has to be boosted. Their self-image has to be boosted. They have to be taught different types of psychological mechanisms to take care of when they have stress or when they are facing depression. Imagine now we had COVID-19 situation. Just think about all these migrant women who are not able to go back to their hometowns because it was complete lockdown. They were not allowed to go. If they escaped, they went to their hometown. There also people rejected because of the fear of COVID-19. So this scenario of loneliness and putting ourselves into isolation is a biggest threat to the mental health. So the preparation basically matters. How well our children, our women are trained to take care of themselves when such situations happen. So isolation is another major issue which was found among the migrant workers, which caused a lot of psychological issues among the women. Next thing is, in the name of giving a job, women were migrated from one place to the other. Even when we talk about marriage, there are a lot of brokers, or even there are men, or there are a lot of men in group. They always have it's a technique. Recently it happened here also, where there were a group of boys who were actually they were a kind of brokers. They were brokers who will hijack or traffic women. They will take them to these pimps and they will sell them. So sometimes now this group of men, what they used to do is they will just target young girls. They will fall in love, like they will put them into their love trap. Okay, at least for around say 6 to 7 months, till these girls gain trust. They will behave as if they are in love, and when the girl is like completely trusting, they all will bring these girlfriends. They will rape, and then they will go and sell these girls to the pimps, who are actually, they will take them to the red light area, or sometimes they are also used for extraction of organs. So if it is a migrant worker, especially women, because it is, people think that physically they are weak or mentally they are weak. So they are easy targets of all these brokers who actually supply humans for organs. So extraction of organs also is a drawback when it comes to migrant workers, especially women. Another thing is superstitious beliefs. So these migrant women who are like away from their country or village, and they are not very familiar with the area, they again become targets of people who will abduct them, for super, like they will suppose somebody recently there was a case in Kerala where there was husband and wife, and they never had a child. It was since say 6 or 7 years they were not having child. So the tantric said, you have to give a human sacrifice. So they targeted actually a family which was not from the particular village. They took the child, they kidnapped the child. It was a girl child, they kidnapped, and the child was sacrificed. So they are again at the risk of this particular thing which we say superstitious beliefs. So they are very easily, they are targeted by people for superstitious ceremonies. So migrant women, when we say, they're also at the risk of falling into the trap of people who want these women for some sacrifice or some procedures. There are also some procedures where these women are told that they will be given a job, or they will send them to a home where they will have some pujas like this, and they are literally raped. So superstitious situations also are a threat for women who have migrated from one place to the other. Next is this is sex exploitation. Okay, this is commercial sexual exploitation. So this is what I was talking about, trafficking. In the name of giving a job, women is trafficked. Every day, 160 women and girls are trafficked for sexual purpose. And again, here also, if they are migrated and they don't know the language, or they are not comfortable with that particular place where they have migrated, or they are not communicating properly, or if their educational status is very less, or they are not very sharp, or they are being targeted for commercial sexual exploitation. So girl children are kidnapped. So they say that around every 4 minutes there is a child or a woman who is being abducted for commercial sexual exploitation. And especially these people who are migrated and they're not familiar with that particular society are the major targets. So when you say sexual exploitation, a lot of women who are migrated are sometimes they are sexually exploited, and they are sexually abused. And also sometimes it can be with their will and wish, they go for it, or sometimes they are actually used by the people who actually take them, the agents. They sexually abuse them, or sometimes they say that they will get married, and they are made to have sexual relationship, and it also leads to pregnancy in the workplace. So women, especially in India, that women who are married If they get pregnant, is taken as very normal, but out of marriage, if somebody gets pregnant, you can imagine their situation. So they are completely, they are completely thrown out of the village, or sometimes they are also rejected in their society, being labeled as, characterless women. So sexual exploitation also leads to pregnancy at workplace, where it can be forced, or sometimes it can be consensual relationship. But again, that leads to pregnancy, which again, already a pregnant woman will have a lot of stress. And if it is out of marriage, then you can imagine. So all these situations will lead to a lot of psychological problems for this particular women. Next is women, when they don't have safety and security, their housing conditions are not good. Sometimes they are even in a state where they sleep on the roads, or they are in huts which don't have doors, or you can easily break in, uh, because they have migrated from one place to the other because of poor housing conditions. They are robbed. So again, imagine if you are not safe and you're in an open ground, you sleep in an open ground during the night, how insecure you might be feeling. So a lot of women, those who are migrant workers, come with psychological problems. They complain more of insomnia. Insomnians, they don't have sleep, because of the fear of being robbed or raped or abused. So they also have issues related to sleeping disorders they have. So these women are sometimes robbed. Whatever they have been robbed by the people in the community. We also had a family near my village, where there was a family. Actually, he was a headmaster. He was transferred from his native place to this place, Tirupattur, and it's a nearby village. So he felt comfortable with that particular village. So he bought a place, built a house. He was staying in that particular village because he was about to get retired. He had three girl child, and one girl was going for job, another girl was an engineer, and the last girl was going for college. Now because they migrated from one village to the other, the village people were not able to digest that. So most of the time they will be giving them trouble because they wanted to throw them out of the village. So they were giving so much torture that it came to an extent where these girls were ill treated by the village boys. So they were physically commented, they were actually physically abused. They were when they were walking on the way, or the father was given filthy comments regarding the physical body of their daughters. So this is how the people in the village, they wanted that family to move away because they had their own land and house. They wanted them to vacate. And there was one stage where this father, it went to the peak where they were psychologically down. It went to the peak where one day they all decided, with the three daughters. He called the daughters as a whole family. They locked the door during the night time, and they all father hanged these daughters, gave poison to the wife, and he also had poison, and they all committed suicide. Why I am telling you this is, just imagine the trauma they might have had. They struggled for years. They were trying to face all these things what they were doing, but later at the end, when it went to the peak, psychologically they gave up, and the whole family committed suicide. And they wrote a letter stating who all were responsible, and whatever money they had and the house, they donated to we have a Ramakrishna mutt here. They donated that house and the money. So to some extent, that the capacity of facing situations is possible. But when it goes out of limit, there is the time when, as people in the society, and the counselors out there, or sometimes even if there are neighbors, we have to understand. So what I will tell you is basically, When somebody is being abused, they will give lot of symptoms. So we have to learn what are the symptoms to identify somebody being abused, because when somebody is being abused, out of fear they will not express, but their body, their body language will tell you that they're undergoing either sexual or physical abuse. So as people in in the community, it is our duty to train our children to even identify, and also to learn how these people who try to put try to approach us or want to take us into a wrong way, their body language also has to be taught. So identification of people with abuse, especially the people who have come from one state to the other, to your own village or to your own college, somebody is coming and working along with you as a colleague, we should be able to identify and try to communicate. At least we should try to communicate with these people, talk to them, give them support which is basically needed, so that security and safety can be given by us. Next is the harsh environmental condition where these people are living. So I told you already, people will sleep on the roads. Just imagine a woman who's sleeping on the road, how safe I will feel. So that itself will, build up the stress and anxiety in me. And later, if it is for a prolonged time, most of the migrant women are, staying in places for a longer period of time. And sometimes there are situations they will never go back to their hometowns. So in those situations, imagine their stress level, it starts and like day by day, it's like increasing. And later, at some point or the other, either it's going to burst, or sometimes it may also, when it bursts, it may lead to suicide, or it may also lead to, self-harming, and also it may lead to some psychological disorders. So harsh environmental conditions. When people come from these conditions, they have a lot of mental health issues related to the place where they stay. So when we do assessment, we also talk about their socioeconomic status, and also from what type of area they are coming and what situations they are basically in. So our basic need is shelter, shelter, love, and the care what we have. If those basic needs are not there, automatically that will lead up to mental health issues. Workplace accidents. Sometimes when these women are taken by agents without because they have financial issues, they are taken to places where the conditions are not, safety measures are not taken care of, like we have this agarbatti work, brick work, and sometimes during the work they may end up into some accidents by which sometimes they may even lose their lives. And these things are basically hidden, they are buried. That is what I will tell you. Like, even the family will not know what happened to them. So this is again another pathetic situation where there are a lot of accidents happening, no security or safety measures are taken to protect these women. They are in unsafe conditions. They are even packed in rooms, like 10 into 10 rooms, where there are even 6 to 7 women living there without any toilets. They even without toilets, when they go out in nights, they are easily targeted by men. So workplace accidents also are happening, and this area also has to be focused. So basically, it is also like ma'am said, yeah, NGOs, lot of NGOs are doing a lot of things for these group of women. And also even the government has to focus on the safety and the hygienic measures which has to be taken, especially their psychological health has to be taken care of, where we train a lot of women for to take care of the psychological aspect. Especially counselors needs to be appointed to take care of these women. I can say that the NGOs are doing lots when it comes to migrant workers. A lot of even counselors go from villages to villages, meeting these women and giving them psychological support. So not only people like counselors, even individuals can also help, especially in workplace, people can do that. Malnutrition, yes. I always believe that, it is known that your mental health is connected to the physical health. If physically we are not fit, obviously, easily we will have mental health issues. So these women, because of financial issues, they are underpaid. Sometimes especially in Corona period, they were not paid at all, and there was scarcity of food. They were even begging for food. So automatically, a lot of research articles says that women migrant workers have issues with their nutrition. They are anemic. So if they are anemic, automatically their mental capacity will also reduce. So easily they may get stress, they may get anxiety, depression, whatever. So mental health issues are directly related to their nutritional status. So again, this also contributes. Imprisonment without any reason. These women, these migrant women, sometimes they are, without their mistake, they are thrown into prisons. Why I'm talking about this is, there are a lot of women who have migrated to Malaysia, Singapore for work, especially we have this palm oil, they have farms, so they take a lot of people from India to Malaysia. There they are actually, they will take their passports, their contact numbers are, the family, they are not allowed to contact their family members, so they're ill treated, and sometimes they are caught without their passports and they are in prison. So there are a lot of Indians, even women, Indian women who are in jails, but their families don't know anything about it. So they don't have any other option of coming back to the country also. So imprisonment without their mistake, they're easily blamed, they're easily targeted by the local people. Suppose somebody has done something wrong, because these people are from another state or some another village, they may not be very much, comfortable with the people around, or approaching the police, or even health facilities. So the mostly any illegal issue or anything, they become easy targets. So they are blamed for that and they are imprisoned. So this also is a leading cause of women who are thrown into prisons without their mistake, and they undergo a lot of stress, anxiety. Of course, yes, the treatment which has been given in the police station, or whether it is given in the prisons, also is a contributing factor for them to have post traumatic stress disorder. Racism and discrimination. Now, when I say racism and discrimination, it can be because of the color, and also because of from the country from where you're coming. So this also is a major cause, where migrant women are being discriminated because of their race or the color. I can give my own example. My father is in defense. So like, we get posted to different states. So I have faced this discrimination when it comes to color, So when we were posted into North India, so when I was a school student, when I go to school, no, we will be targeted, we will be bullied because of the color. No, they will call us brinjal, in Hindi, no, they will say bangan, or they will say, dark skin girl. That is how people will point out. They will say that, did you see the dark girl? This is what. So as a young person, when my body image is very important to me, imagine if I've been fingered by my color, by my color, automatically that itself gives me a lot of stress. So I never used to go to the stage, I never used to participate. It also affected my education. So the women, so I can see that, I can compare myself with those women who are going from one country to the other, by their color, or by the body structure. They are being discriminated. That itself is an adding up to their low self-esteem. So that contributes to low self-esteem and poor body image, which will isolate them. And they will, that is the time when psychologically, when they become weaker and weaker, that will automatically reflect their poor physical health. We also have situations like, especially during COVID-19, we had we have students from Manipur, and they look more like Chinese, no? So the local people, because these are villages, so they don't know how to identify Chinese from the Manipuri people. So they were not allowed to go walk into shops, and there were even people who started complaining not to allow these girls to come out. There was also a situation where our own educated people, they didn't want to go closer to these. So this is what we are basically talking about. Imagine when they come and talk to me and share things about being discriminated just because they look like Chinese, and they think that these are Chinese people coming and they are going to give corona. So they are not allowed to enter shopping malls. There was a situation when literally they were asked to move out of the shopping mall. So that it's seriously very stressful. So this will contribute to the low self-esteem of people. So this thing happens when people move from women move from one state to the other, from one country to the other. So racism and discrimination will add up more issues to the mental health of these women. So I just want to, why did I tell you all this? Like, there are many more reasons, many more reasons how this particular thing of women moving from one country or one state to the other as migrant workers contributes to the mental health. The important thing what we all have to understand is prevention is basically better than a cure. If somebody is moving out, before that they have to prepare themselves. That is very important. Whether these are educated women moving for educational purpose or job purpose to another country, they have to prepare themselves first. First thing is, when you talk about individual coping skills, main important thing is know yourself first. Okay, first we have to understand our own personality. Like, what type of personality I am, whether I am a person who is very sensitive, or that empowering is basically very important. Knowing yourself, your big weaknesses and your strengths. So any weaknesses you have to make it as a strength. Suppose if it is because of a poverty, a woman is moving out, she has to empower herself. First of all, accept things. Especially when a woman is moving from, because of poverty, if she's leaving her family, moving into another country, she has to completely prepare herself for leaving the family back or leaving the children back. Okay, so that preparation is basically very important. She has to completely mentally prepare herself to leave her own children from volume. I'll finish. So the main thing is, like, we have to prepare our own self. We have to understand our personality and we have to prepare. Next thing is trust your instinct. As a woman, we have to trust our instincts. See, I always feel that women have extra sense, especially we have 5 senses, we have 6 senses. So if something is like, okay, somebody has moved from one place to the other, if it is a dangerous situation, or if they are talking to an agent, they want to go for work, it is a real economic situation, the women needs to move, they have that instinct to find out whether this person who is going to take us is going to really keep me safe or something else is going. So first understand that instinct of yours is very important. If you feel that inside your mind you have a feeling that no, this is not going to be safe, better not to. So trust your instinct, especially when we move around, when it's only for, even for normal women like us, when we are moving from one place to the other, if your instinct says that no, this is not correct or this man is not correct, I have some of my own doubts about this person, kindly stop, don't go. So trust your own instinct. This is what every woman who's moving from one place to the other has to do. Then learn to read situation. So coping up mechanisms, training yourself to cope up with different mechanisms, very important. And also we have to be very aware. And whenever you go to a new place, we have to blend in. We have to blend in. So if you're blending in, again, preparation is important. You have to learn about their language, you have to learn about their culture. You also have to learn about the job situations where you're going. Going and having a look at the thing is better always. So that is what I'm telling. Stay aware and try to blend in with the community where you're going. So preparation is very important. We have to communicate to local people. Again, communication to local people, find out where the police station is, or if any health services are availability, and communicating with the people in and around will always be a safer mechanism. Yes, research the destination where you're going, stay in touch with the family members. Okay, even due to some reasons, even for education, we are going from one place to the other, or maybe for job when we are going, always try to stay in touch with the loved ones. We need to talk to them. That may reduce the stress what we have. Frequently sharing things will help people to overcome stress they have. Then before going from one, especially when we go abroad, you always should have extra copies. You should keep, people should keep extra documents, travel documents with them. Some situation happens where they may need or they may lose their documents. They can use these Xerox photocopies of these documents to help themselves. And also at the end, just I want to tell you that it is professional help, which is counseling basically. If people feel that they are not able to cope up with their psychological issues, they can very well go and reach people who are professionally trained, especially counselors. They can go and share their problems with them, and if they are undergoing any psychological or psychiatric issues, they will be easily referred, so they can get mental health. So by this I'll stop. I know it's already time. So thank you so much for giving me this opportunity. Thank you.
Thank you, Madam. I know you have a lot to say about how this migrant women can cope up. You shared a vast aspect of the information. Thank you so much. Winding of the time, quickly, one or two questions I would like to ask,
Yes.
taken from the chat box and the YouTube channel. Okay, so one question is there any common forum where this migrant women can seek help or complaint? We talk about online counseling, kind of a helpline, whatever it is. Immediately, where can they approach to get help, whether psychological help or whatever it is?
Actually, during this corona period, there are a lot of NGOs. They have opened up online counseling. Even we also have, like in our college also, we have this online counseling concept where we have given list of phone numbers of counselors, which even they can directly contact them through phones, or they also can have even people who can have access to internet, they can contact. Even government also has a lot of counseling centers, and also they have developed a group of numbers of counselors to whom they can contact. So in Tamil Nadu also we have that list of counselors and their numbers. This is already there in the in online. Through that also they can contact. Or even if it is directly they want to go and approach, there are a lot of NGOs in different places, and also government hospitals nowadays, they do have counseling centers, so there also they can approach.
Yes, madam. So thank you so much. And
Yes, sir.
I know people would have a lot of questions since wanting of time. I would like to express my gratitude for your availability, madam. I know how busy you are in counseling people. In spite of that, you dedicated your time for us. Thanks a lot for sharing. No, it was a wonderful session, madam. Thank you so much.
Thank you, sir. Thank you.
Yes. Now over to Anne Lisa.
Thank you, ma'am, for enhancing us with surplus knowledge about coping skills for migrant workers. And it was really an eye opening session. Thank you, ma'am. I now call up Ms. Hema Malini from First MSW to introduce our speaker for the fifth session.
To one and all. A master can tell you what he expects of you. A teacher, though, awakens your own expectations. Now, I'm very privileged to introduce our beloved speaker, Dr. Soumya Shankar, to all our participants.
Thank you so much. I would like to especially thank Dr. K. Rokiraj for giving me this opportunity. I hope I'm loud and audible.
Yes, yes, you are loved.
I,
Can you give us
okay, thank
some
you so
time to
much.
introduce you? Introduce you. We have not introduced you.
Yeah, please,
Just
please,
wait for a
sorry.
minute. Yeah, please.
Okay.
A master can tell you what he expects of you. A teacher, though, awakens your own expectations. I'm very privileged to introduce our beloved speaker, Dr. Soumya Shankar, to all our participants. Dr. Soumya Shankar, Department of Sociology, Social Sciences and Social Work. Dr. Sakuntala Misra, National Rehabilitation University, Lucknow. She did her PhD from Jawaharlal Nehru University, New Delhi, and MPhil from Delhi School of Economics. She is an assistant professor in the Department of Sociology, Social Sciences, and Social Work in Dr. Shakuntala Misra National Rehabilitation University. Her areas of specializations are juvenile delinquency, gender studies, child protection, and rural development. She has more than 12 years of working experience with various governmental, non-governmental, and corporate organizations. She was worked with Bhumi Sudhan Nigam, Reliance Limited, Hindustan Latex Limited, Prayas, etc. She was also entrusted with the post of State Head Women in the State Resource Center for Women and Child, Government of Uttar Pradesh from the year of 2018 to 2020. She has also contributed as member of important government such as bodies member drafting committee for the rules for National Commission for Children Rights Bill 2005, member of the drafting committee for the Act on Offences Against Children, and member of the drafting committee for the Integrated Child Protection Scheme in Delhi. Dr. Soumya has a number of publications, book reviews, and models editing in her name. The vibrant academician has also presented various papers and presentations in seminars, conferences, and workshops. I felt honored to welcome you, ma'am. It's over to you, ma'am.
Thank you so much for the noble gesture of introducing me with such beautiful words. Uh, I am presently working in the Department of Sociology. I'm a sociology teacher, and our university I would like to introduce to you is one of the one of the only university that is mandated towards, or our areas are specific towards the differently abled. So in our university, in higher education, we have students who are hearing impaired, who are visually impaired, who have locomotive disorders, and they are studying together with the I don't want to use this word, but the other non differently abled children. And it's a beautiful a sight to see in the university, where each of them are helping each other to walk to the class, to take down notes, to discuss issues, to interact in a class. I mean, there are sites where we see a locomotive disorder child on the wheelchair being pushed by a blind child, because then there is a symbiotic relationship between both of them. They're both helping each other reach the classroom. So it is definitely an honoring experience to be there, and I'm very lucky to be a part of such a venture. And I generally do this because not many people know about our university. It is called Dr. Shakuntala Mishra National Rehabilitation University, that is actually mandated for inclusive education of the differently abled and the so-called able, which I don't like using that word, but whatever. And I invite all of you, if you ever get a chance to come to Lucknow, to kindly visit this place and have a look at the the beauty of relationships, the beauty of amalgamations, the beauty of being there for each other in higher education. Okay, I have been entrusted with the responsibility of taking a session on the well-being of the migrant women in family and in work life and workplace. I have made a presentation which I would like to share with you, and then we can probably take questions from there. I just need to know, Mr. Raj, how much of a time do I have? Because I know we are running really late in our session, and the patients must be running low of most of you. But I would like to, just up my stuff a little quicker if I know how much time I have. Anybody who can anybody who can, okay, fine, I'll take my time.
Madam,
Yeah.
can you come back? Repeat, please.
I can hear you.
Yeah, yeah. Yeah, you wanted to ask something?
I'm asking how much of a time do I have to speak, because we are
Yeah,
running late.
you can take another 20 minutes, madam.
I can take 20 minutes. Thank you so much.
Yeah, thank you.
Okay. Right. Okay, I have a presentation that I need to share.
Yeah, keep it is visible.
Okay. Can you see the screen? Is my screen visible?
Yes, very, very much visible.
Okay. Now my topic is my topic is sustaining the well-being of women migrant workers in their family and work life. Okay, first I would like to explain what actually migration is. Migration is a physical movement of a person from one place to another, and it generally we've all studied it in our schools and in colleges. Migration is a very important aspect of sociology, and we teach that quite in depth. It is basically movement of a person from one place to another, generally because of certain push and pull factors. When we say push factors, means that the place that you are staying in is not very conducive to your living environment, not very conducive to, it's not very encouraging, or it's not providing enough opportunities for you to move ahead. So the area pushes you away from itself and forces you to go to another place to look in for opportunities, to for better living conditions, so forth and so on and so forth. Then there is another concept of pull factors. So while you are being pushed from your area where you are residing, there is another area which is pulling you towards itself, because of the attractions of the city, or of attractions of that place. Attractions need not necessarily be the glamour behind it. Attraction specifically means how you expect, or you think that your living conditions and life standards and life will change once you shift to this place. And this is one of the main reasons why most of the people migrate from their residential local areas of domicile, and move on to different places where they are referred to as migrants. It's relevant here to discuss this, or it's a little I will say it's a little contradictory, because people move from one place to another in search of a better lifestyle, improved well-being. But is it really happening in reality is what we really need to understand and figure out. Trying to come to a conclusive remark or a statement difficult as everybody has their own set of opinions. Speaking to these people who migrate, they might say, yes, we are better placed now because of different reasons. But we as social scientists look at it from a different perspective, where we feel that there are times when people are really not aware about what social well-being actually is. What is it that focusing on, and what is it that they may be thinking is important for their life, and what actually in the longer run is more beneficial to them. So having explained the concept of migration, it is often seen that people generally move out of their place for better work opportunities. Though there is education also is one of the reasons, but I need to limit myself firstly to migration that occurs because of job opportunities. Secondly, I'll be focusing myself on migrant women in particular, because it's not as if only women migrate. Obviously, men migrate also, and to a larger in a larger number than women do. And thirdly, when we talk about migrant women, and we obviously understand that we're also talking about women, those migrant women who are actually, since the topic also includes work life, so that means we are talking about those women who are migrating and are presently also working in the area where they've migrated to. So there can be a number of areas and arenas where these women might be working, but I'll be concentrating my discussion on those women who are found in the sites construction sites, or are in the casual informal sector, which is and my focus of this discussion would then be on women who are migrant, who are working, and working in the casual informal labor intensive sectors in construction sites, because more or less their is the same, whether they're working in brick kilns, or they are working in all their more or less their conditions and their uh, difficulties are one and the same, which needs to be discussed, focused, and taken care of. It is seen that India is a traditional society where women individually are not permitted to move out of their house. So most of the migration that takes place amongst women, amongst the women, is basically if their entire family is moving out, then they move out with their family, or mostly and maximum is because of their post-nuptial migration. That is, after marriage, women move out with their husband. So such a situation where women are moving out of their area where they are staying, or migrating from their area with their husbands, that is something which is encouraged in the Indian society. But if a lady is moving out on her own, wanting to do something individually without the family and husband, then it is something which is not really taken well, and people are not, the family is not very happy about it. And that is why we see that most of the migration that happens in women is short distance migration. It's not very long distance that they are moving from North India and moving down south to the southern parts of India. It's generally not that. It is mostly if a person is staying in probably a village near Delhi, or in a village near Lucknow, or village near Hardoi. So they'll just move to Hardoi, they'll move to Lucknow, or they'll move to Kanpur. These are the towns that I'm naming from actually Uttar Pradesh. And same is the case in the southern part of our country, where we see who live in and around who live towns and migrate to these bigger towns for better opportunities in terms of employment, occupational opportunities. Then there is rural migration also happens, which is mainly because of marriage. And as I've already told you that women also migrate with their husbands and move out with their, they create their own households when they're after marriage. And what happens that initially they move out with their husband. This is a trend that is often seen, that initially they move out with their husband because of marriage, or they have to live together. But eventually it happens that even these women get drawn into the same sector, same area where their husbands are working. This again I'm telling you, this is, I'm talking about the labor in intensive industries. I'm not saying that if a person is moving out to another place and he's an engineer and he gets married and the wife also becomes an engineer. No, I'm not saying that. I'm talking about the very, very specific labor intensive sector where unskilled labor or skilled labor is the focus that people have, or skills that the men have. And if they get married, the women also eventually enter the same space where their husbands are working, and they also start working together in the same area. And this is how women's participation in the economic sector begins. A housewife gets converted into an economically motivated migrant whose motive is to aid the household survival. So the husband also gets involved in economic upliftment of the family, in the in trying to get in economic support to the family. And what is unfortunate, and here where gender studies really comes in, and we often talk about it, that no matter how independent, empowered, working a woman may become, she cannot leave aside her domestic responsibilities. And we see that these are the double standards of the society, where you want the woman to move out and get the booties and get the money and get the amounts and everything, but you do not give her the space and the time to live her life, because once she's in the office, she's a working woman, and once she's home, she's a mother or a wife or a daughter. So this is the irony of the situation, irony of the Indian society, where we give a lot of respect to men who are working, and once men come back from the office, everybody is like, okay, he's come back from the office, give him a cup of tea. And the mother also says that, oh, my child is coming, you take care of him. And the wife says, oh, my husband has come. The kids are told to keep quiet, Papa has come, and your father is here, you get angry, and just sit down, let him relax, have a cup of tea. But I mean, I'm sure there are a lot of women who might be a part of this presentation. And if they really look back, is there anybody who really when you reach home after a rough day, or not even a rough day, a regular day at work? But I think we may have similar views to share if we get an opportunity to speak with each other. So yes, there are double expectations from women, there are triple expectations from women, and we have to abide by those expectations for a happy married life, or a happy, for our, for the well-being of our family, if we are saying. So when my topic is that if you talk about the well-being of at family and work life, so no well-being can happen if there is no mental peace in the house. So for mental peace, yes, you have to understand the rules. And I wish situations change. I wish people are able to understand the efforts that are being put by women in trying to get the home work balance. And I'm sure there will be a time where we'll be able to see this balance pretty soon. Okay, now what could be the reasons for these, I'm sorry, I think, reasons for migration by women in construction work? As I told you, I'll be focusing. Generally, these are the census that have, there are this 2011, we say that it is around 48.56% of the total population in India. And out of that, 0.67 of the female population is designated as workers. So they are semi-skilled, skilled work, unskilled workers. In India, it was estimated that more than 90% of the working population were dependent on the informal sector for their livelihood, and almost 50% of the national income that is involved from this, that is evolved, comes from this sector. Uh, since I have to talk about the well-being, so there is a term that I wanted to introduce you to, and that is the occupational health. And occupational health is defined by the ILO and the WHO as the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. This is not particularly for the sector that I was talking about, but in all the occupations, there is this concept that is being worked upon and being taken very seriously, is the physical, mental, and social well-being of the workers. Because the outcome, the optimum benefit, and uh, the capacities cannot be reached. The optimum capacities of no worker can be reached if the worker is not really physically, mentally, or socially in sync with the kind of a job that a person is doing. And that is why this entire presentation and the topic that has been given to me, and this entire seminar is very relevant, because you are talking about an aspect which is generally not spoken about, or not really. I won't say not spoken. It's not like a hush hush about it, but it's not given too much of a due attention. And I'm very happy and proud of the fact that you people thought about it. The organizers thought about taking this topic and giving its due consideration. So occupational health is very important, and opportunities that are there in the construction sector that women generally get is because of familiarity, as I was saying, that since their family members or their spouses are already in the area, that is why they get this opportunity. And as I have already said, that most of them migrate to these areas is because they move with their spouse to start a family life or to continue with their family life, and eventually they get into this entire economic sector. And in case, as I said, that as I told you earlier also, that autonomous migration of the women without family and without spouse is not something that is encouraged, and it is often seen extremely negatively by the society and the family members, where a woman is not expected to move out to fend for herself or to get a job. And how can you be so ambitious, and how can you be so daring to be out of your secured social setting to move out into an area where you do not have anybody to look after you? So women are always looked after by the family and the society. So let's see that since we are expected to look after people, but we are in the situation that we are the one most looked after, and how well is, I don't know. Let's leave it there. Okay, and as I said that family members do not perceive, and it is often taken as adverse to the family, to the females who are migrating with their spouse, or they do see negatively as if they do it individually and separately. Okay, their well-being, the well-being of the migrant women in the work life, there are certain things that I would like to focus on very, very quickly. There is a study that I was going through, and I also have got an opportunity, and a very close opportunity, because I had very close interactions with these migrant women, because when our university was being made in 2010, 11, it was being, when we entered, it was half, 1/4 of it was only constructed, and rest of the construction we saw in front of our eyes. So there were a lot of women who were working there, and as a sociology student and was a teacher, we used to interact with these women, and there were certain observations which definitely which were reiterated by the number of studies that I did later and try to understand the situation. And these are certain aspects which I personally have also seen, and people have also quoted it. And I would like to bring it on the forefront here is that if you talk about for these migrant women and their work life, and this is the workplace that I'm talking about. Okay, the entire thing is the people who are working, what is the situation in that working area, and what is the situation of these women at home, that is their migrated homes, not their back home homes that I'm not talking about. So well-being at work life, when they are working in a particular area, what is the situation, what are the problems there? And the biggest is there is no proper drinking water, there is no electricity, the is of the toilet facility, women do not get an opportunity, do not have washrooms to use. So on one side, the entire country is talking about uh, no open defecation or India free of open defecation. And here we do not have toilet facilities. Most of them are forced into open defecation. This leads to a major lack of sanitation facility. There are hardly any toilets in the construction site, leave alone toilets for only women. There are no toilets. So we talking about a separate toilet for women is out of question. So women are left with no choice but to respond to the open places for their nature's call. As you can see from the little pie diagram that I've made, that there are out of a lot of studies that I saw, and there is this also the study that was conducted by the Health Management Institute, where they say that there were only 5% of women's toilets, there were 20% of shared toilets, and there was 74% open space. That's a 74%. That's a very, very, very high number. 74% of workplaces do not have toilet facility. I'm not talking about women toilets. I'm just talking about toilet facility. Toilets for women is something is of our dream to still be achieved. So yes, this is a major problem that can be seen. Another aspect that was seen is that which we discuss is that while ownership to assets improves, and back down in their villages, they may not have they may not have a TV, they may not have a fridge, probably the need is not there. But with these small things, when they migrate, these are very, very small things that small for us, probably big, very, 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 very big for them. But they start collecting their assets. But their living conditions like the space, area, sanitation, health, hygiene, that really deteriorates. That is a big problem. Or also the ownership of the housing units comes down, it declines. They do not have high housing units. Again, housing units, by housing units, I mean that they do not have proper areas. They do not have a space of their own to sleep in. They often sleep in tents or whatever little temporary shelters that are created for them, that is very dilapidated. It's definitely not fit for their well-being. Definitely not fit for their well-being. Whereas back in their villages, they have more space, and they do have their single rooms where they accommodate themselves. One little nuclear family, they single room where their kids are there, and there is more space outside in the backyards, in the front yards, and there is more space for children to move out, children to play, children to get breathing spaces, which definitely is a problem in such areas. And another aspect that is often discussed together with migration is the whole aspect of slums, the entire aspects of the slums that have it's a different discourse altogether, and we don't have time for that. But yes, migration, and because of this, migrant laborers and workers who have come from the different cities, different areas to another city, the density, because of the density of population increasing and lack of place, then the slums come into being. And slums have their own set of own areas. It's like a whole area of problems. They need we there is there's a whole ministry working, and there's a whole department working on the slums, which we call the Juggi Jhopdi departments, Juggi Jhopdi uh, ministries that are taking care of their well-being. So yes, there is definitely, that also is a point that is to be taken into consideration. Now, as see, I know that amongst the participants, we have a lot of NGO workers who are here, who are presentation, and I'm sure yesterday and in the earlier sessions, things that were discussed, I hope it is not repetitive. I was unfortunately not able to go to those presentations since I was traveling. But I would request the NGO, the development sector working, people who are working in the development sector, to kindly uh, give it a thought where if I say that there are no legal safeguards for the construction workers, so kindly try and get activists rolling and notes preparing and sending it to the right hands, where there are safeguards, there are provisions, but these provisions are not being put into use. So this is really my request to you all to take some pointers. They are very small pointers. I'm sorry for, I don't mean that I'm giving you great knowledge, but whatever little I'm able to share, if it all, I would kindly request that do take on these pointers and bring it to the right forums and push it at the right forum, so that this presentation, once you move from here, you're able to make a change in, if not many, but at least a small section of a construction site, right next to your, right next to, right next to your, the place that you're staying in. Maybe a small help that you can do to people. Okay, so there are no legal safeguards for the construction workers, and they can be removed from work anytime, as they are called, the unorganized and the informal workers. So this is something that needs to be worked upon. A majority of construction workers who are employed as casual, and most of them are employed as casual and day laborers working in the informal sectors, and definitely there's a job insecurity for them, because any day they can be asked to leave, and then once you are asked to leave your job, there is this whole list of responsibilities and people that are behind you that you have to take care of, and which definitely works very negatively on the mental health and mental well-being of the person who's been asked to leave. The job tenures are not fixed, and there is always this threat of termination, because of which we are left at the mercy of our masters, and that is where exploitation also comes in. Since you know that you do not have any place that you can go and take your claim, or raise your voice, or make a complaint, you are left at the mercy of your employer, and exploitation, particularly for women, exceeds beyond our imagination, probably. There is, due to the absence of any kind of a contract, the women lack access of employee benefits. Since there are no contracts, they do not get any benefits such as health care or sick leave or maternity. Maternity leave again is a very for the casual laborers. Maternity leave. I wish a lot needs to be done. A lot needs to be done. Are they not work? Are they not humans? Are they not loving others enough that? Are they means? Do we think that they don't deserve it? Why cannot they get it? Why can't they get their maternity leaves? Why can't they have their job security? At one hand, we say that women are the genesis of everything, and you are not giving enough of security to the woman who's actually creating this world. And then also you decide that okay, the government employees will get the maternity leave, and then they are they are this, and then there is this. So what is this whole stratification, social stratification? Benefits are also going to the ones who are who are so-called economically better off, rich. Due to then there are obviously no facilities of drinking water. The sanitation conditions are really poor over there. In spite of a contract labor act which says that the contractor or the employee must provide a suitable accommodation to the laborers, the people, it doesn't happen. This act is definitely not being adhered. The contractor, the employer do not take it as, do not feel that it is their responsibility. I've spoken to them, they feel, my work. How can we do so much? The government takes away, we have to give so much of a bribe, and we cannot take care of our employees. It's, yeah, this is also there. Illness, accidents, none of it are being taken care of by the employers. For women worker, there is no provision of a maternity leave that I have already told you. What are there are I'll be very quick because I think I'm getting some pointers as to my time is probably getting over. So I'll just make it very fast. There are certain discriminatory practices for the women, and firstly is that they unregulated employment here, they get minimum wages. There is denial of the minimum wages. They are paid less than the men. There are insecure conditions in the working place. There are sexual comments that are being made. There is a risk of accident, and without any healthcare and insurance, so it has a direct impact on their family. Ailing mother means it's an ailing family. It's an ailing family. A hurt mother means it's a hurt because she is taking care of the entire well-being of the family, and there is no doubt about it. If a woman is sick, she doesn't get time to recuperate. She has to take care of the family, and the family, if the woman is sick, the family feels sicker. Then there is a lack of toilet facilities, which is a very big thing for women. I hope which the society understands the need of toilets for women. It's not so easy. Even in open defecation, it may be easy for men. It's extremely difficult for women to do it. Women are not given maternity leave, breastfeeding breaks are not there, creches. Again, these things I wish were there. While I'm talking, I still feel, oh God, when will this happen? A creche, a daycare facility, do they not deserve it? A breastfeeding break, yes, she needs a privacy. Nobody wants to breastfeed in the open with so many people around. So, well-being in family, because of the health risks due to both productive and reproductive roles, women are concerned. For the women migrants, it is a major concern. Indicators of maternal and child health reflect poor health status, which is a big problem, and there are no sanitation facilities. Malnutrition, there is a major malnutrition and anemia in children. And especially amongst the adolescent girls, it is widespread. Migrant women and girls are exposed to sexual abuse in the form of gestures or unwanted touching, either by by their co-workers or even by the supervisors. And for a growing woman, just for a growing girl, having to go through these undue gestures and lewd comments takes away the pride. It hits on the pride of a woman. It makes her insecure for her to face a larger society at a later stage. It becomes a big deal. It is a big problem. And some studies have also shown they do. I mean, I've already told you this, that they do not have their basic labor rights. There is, though there are provisions for it, that there should be food, shelter, wage, health, employment security, but none of it is there. So one needs to work upon trying to get these provisions in place, getting their security systems in place, social security in place, because if a woman is not socially secured, then we cannot talk about her well-being and definitely we can't talk about her well-being. It's very difficult to talk about the well-being in the family. And most of the problems are another aspect that did come into the forefront was that they are not able to reap the benefits of the provisions or the schemes that are there, is majorly because of the fact they do not have their documents in place. They do not have their identity cards in place. It was whenever this when this Aadhaar movement started, there were so many of them who could not get their cards made, no matter what the government says that is being made for everybody. Do a study on it and you'll find out. Getting Aadhaar made was not as I'm not criticizing anybody. I'm not saying that the government is not doing it. I'm saying that yes, it was difficult, because even for Aadhaar you needed some residential proof of some proof, which firstly migrants don't have, and women migrants, definitely women do not have identity cards. So we can begin with at least providing them their identity cards. Women don't, I mean, even if they have it, it's not in their hands, it's with someone else. Women do not have identity cards. I live in a colony, I mean, I live in a complex, and we have a lot of domestic helps coming from outside. And there was this whole campaign that was started that no allowed inside the campus if they do not have identity cards. And so the Residential Welfare Association got identity cards made for them, which was just to say that okay, this is her name. It had no government authentication. It was not a government document. It had no legal value. But the women were so happy. They were holding a card in their hand that had their photograph and their name, and they felt so nice and proud about it. So since they don't have these documents, they are not able to get the benefits of the provisions that the government has very ably made for them. Many migrants remain excluded from various government schemes due to neither their nor their status. Whether they will be benefited from the place in the place that they were staying in, or they'll get the benefits in the place where they are presently in, this entire confusion lands up with them not getting any benefit at all. So this is also a major problem. Female migrants are often accompanied by their children into the workplace, as there is no creche or other childcare, this is a very dangerous situation. Small children, very small children in construction sites, which has bars jutting out of buildings. It has iron rods jutting out of buildings. It has boulders, people rolling down boulders. There is a lot of debris which is falling from all the areas. It is an extremely dangerous situation for children, and for children it is a high risk of health issues because of the exposure to dust and other substances outside. Low wages, low job stability puts education extremely behind for most of the migrant family members, where they're trying to get their basic morning, evening food, basics in place. Education is something that is not given due attention or priority in their lives. By the time children approach by the time these children they approach their early teens, most of them land up helping their parents in the construction sites. So educated India and the dream of education India gets totally disturbed here, or maybe dismantled. What are the other vulnerabilities of these children? And the children are often left alone and unattended in the slums or the areas where they stay, and and parents have to travel really far away. If they are not staying in the construction sites, and they go to shelters which are temporary shelters, and they are left vulnerable to a lot of abuse with children alone in the house. And since the houses are not concrete, and they are porous, they are not concrete houses, there is a lot of risk of physical and sexual abuse. There are definitely no daycare facilities where these women can keep their children, and so they have to keep them at home with the older sibling taking care of the younger ones, which again takes away the childhood from this elder sibling who has to take care of the younger one. The generally it is the girls who have to do it, and she is left behind just taking care and not getting enough opportunities of going out either for education or just for a simple play in the garden. And they have, besides taking care of the siblings, they have other responsibilities of doing the household chores also. Unable to support their children's education due to inadequate monetary support, as well as lack of documentary evidences required for securing admissions in the school. As I told you, because they do not have documentary evidences, that is why neither are they able to avail the government facilities. They are also not able to get their children the proper education. Recommendation for women migrant workers: there should be some trade unions or similar bodies that needs to be put up to take up the issues of
Madam,
migrant
maybe you can take another 2
workers.
minutes to wind up.
I'll just take a minute. Awareness camps should be organized so that better conditions can be created for them. NGOs can mediate and facilitate the living places, which should be, as I have already discussed, that they should be proper city. Their living places should have proper electricity, sanitation, health, water, and this should be provided by the contractors. There should be creches, there should be resting places if possible. And again, this should be the responsibility of the contractors. There are acts that tell them to do it, but they are not doing it. After employing the workers, I think this is a very important recommendation that I read somewhere, that after after giving a job to a worker, they should open a bank account for that person, so that the should pay, so that the salary goes directly into the bank account. This will ensure that there is a transparency in the amount paid, and this will also lead to stopping the exploitation and harassment of the workers, and especially the women workers. If the amount will directly go into their accounts, there will be no shortcuts to it. It should be mandatory to display at each site the helpline numbers in case any woman who needs it. Then there should be water facilities, toilets, and bathing. And they should be separate for men and women both. There should be resting places for men and women in the construction sites. They should be given proper shelter, which is safe and secure for all the workers. There should be a coverage of treatment in case of injury, in case of death, that job replacements if person, whoever is eligible in the family, like whatever happened in the well organized private sector and of course the government sector. Then instead of seeing this is just a statement, a line that I made, that instead of seeing whatever you're giving to these workers as welfare, no, you're not doing charity. It is their right. So as long as the employers don't understand this concept that this is the right of their workers, and not as if you're doing any charity to them, the attitude will not change. Because charity is something that if you want to do, you do. If you don't want to do, you don't do. But rights, duty is something that they are supposed to do. Okay, and again, then there's this whole concept of pregnant women being given maternity leave. Then there should be sanitary pads available, machines. There's a lot of money. Again, I'm not seeing this. You may think, what is she talking about? What are you talking about? Vending machines and construction sites. There are provisions. There are programs and policies that are giving subsidies to set up these vending machines. The vending machines are lying in the departments and are not being installed. We need to just push it and get these things put in the right places. There are no dustbins, there are no dumping places for them. There is no solid waste management in these construction sites. We need to keep these areas clean for their well-being, personal well-being, health camp and checkups. Health camps, health checkups these sites. there should be counseling, marriage counseling, pregnancy counseling, all these mental psychological counseling sessions should be taken up. Payments of the women should be at par with the other this is an advisory that was issued by the Commission for Women to the Ministry of Women and Child Development 2020, appropriate measure to address the needs of internal women who were migrating during COVID-19 lockdown. So they were certain that they should be given proper food, they should be provided with proper shelter and accommodation, there should be a safety and security, gender-based, they should be safe from gender-based violence, health issues should be taken care of, mental health of these women should be taken care of, hygiene of these women should be taken care of. So there is an advisory that has been issued by the National Commission of Women, and whenever an advisory is issued, this I'm telling you, whenever an advisory is issued, there are always provisions that are made in order to ensure that the advisory that has been issued is being adhered. So there are ways, provisions, we just need to explore them, and we need to make these provisions reach the migrant women, because these migrant women will not reach up to the provisions. The provisions have to come to the migrant women, and we are the middlemen, we are the middle people. We are the bridges, and we need to get ourselves up and get them what they deserve and what they need. Thank you so much. I think this is it. There is a concluding remark is a benefit remain under investigated. Women migrate for work, capable of being greater freedom, earning cash incomes, thereby undergoing further changes in the traditional gender roles that have been defined, with more interaction in the society and with people like us, and with people like us getting into it, work participation and ability to take this help women achieve active empowerment.
So
with this,
yeah, so it was a very good session, madam. You rightly said it's not a charity that we are doing to the migrants, and it's their right, and there is a duty for the state to do what they're supposed to do to ensure the dignified life of the migrants. So you rightly said a lot of things you shared, and I'm sorry we could not give you more time. Anyhow, the presentation has got a lot of details. Okay, so thank you so much for your valuable time, and I know you have been traveling and you have dedicated your time for this webinar. It was a very insightful session. Thank you so much. Thanks a lot. Thanks a lot. Thank you. So over to Anne.
Thank you, ma'am. It was really an informative session. Thank you very much. I would like to call up Ms. Divya Lakshmi from first year MSW to introduce our guest and our HOD, Reverend Father Andrews Raja, for the valedictory address.
Thank you, Anne. A very warm and pleasant good evening to one and all present here. Myself, Divya Lakshmi from Department of Social Work. It's my pleasure to address our Reverend Father Andrews Raja, SDP, who is head of our PG and Research Department of Social Work at Sacred Heart College, Tirupattur. We are feeling proud to say he is a student of Tata Institute of Social Work Science, Mumbai. He is very passionate towards working with the rural women at the Sacred Heart College, Tirupattur. He brought up different missionaries and invented various activities and connected with rural peoples. The mission and motto of our college is to reach the unreachable star. He is one of the living example for both social work practitioner and full-fledged professor. And he is both resource person and resourceful person. He has helped many poor people and created employment for many unemployed people. He is called as a rural scientist, and he did many research projects and published many papers. Now, I would like to welcome our beloved Reverend Father Andrews Raja, SDB, to give valedictory address.
Good evening to one and all. Am I audible, Arikim?
You're audible, Father. Can you also on your video if you can?
I have switched on the video.
It's not coming. Yeah.
I have unmuted the video.
Yeah, you can go
Yeah?
ahead. Go ahead. Yes.
Okay, I take this opportunity to thank Dr. Arakim for initiating this exercise with National Commission for Women, and it is a webinar project that has been assigned by the National Commission for Women. A wonderful opportunity to reflect on the situation of migrant women. As I was listening to the entire 2-day sessions that were well organized by him with the help of staff and students, and also has selected very rightful, very highly profiled resource persons for this particular theme of study. This study, this entire 2-day exercise comes out very strongly with this idea. This study centered on women hits you very hard, that you are touching all the aspects and needs of the entire family. This was very surprising revelation for me, because we said we are studying one target group, but actually it is not. We are studying the entire family, because whatever was said and done at the end of the day of this 2-day session, we see that when we are really working with women for their emancipation, liberation, and empowerment, we actually enhance the entire society, starting with family as an institution. And therefore, I think the study finds its meaningful place in the research world, in the practical implementation of the projects related to the society, family, and the special target group of our study, women. So we are indeed very happy at this point to congratulate and thank Dr. Arikiraj for initiating this exercise, along with various stalwarts in this field. Just to at the outset, I would like to also to thank our rector, beloved rector, Father John Alex, for giving our words of encouragement and words of welcome. He is our secretary of the college, for welcoming Father Francis Bosco, who is heading a migrant ministry in Chennai, and then across India. He is coordinating many such efforts. And followed by Dr. Sivakumar, a person who is highly profiled and highly scientific by giving us facts and figures and establishing the challenges that are faced by the women in this migrant women in this COVID situation. So it's indeed really a very thought-provoking theme that he took up, the situation of migrant women workers post COVID-19. Okay, and we are indeed very happy that Dr. Sivakumar is a very good collaborator of our institution, and accepts every now and then and supports us when we are there for working together in achieving a lot of work related to youth and youth development. And we sincerely thank Dr. Lovelina Little Flower, for professor and head of the social work of Bharatiyar University, for taking up this theme on role of welfare states on migrant workers, and explaining to us how welfare measures of the state hasn't reached or has reached, and putting it across to all of us that these ideas are supported by concrete facts. While the same idea on the same theme, we have the role of NGOs and industries in sustaining the wellness of women migrants by Miss Padma Priya from Pondicherry. She has really a very outspoken person and has come out with various dimensions of this stakeholders who are involved in the in addressing the issues related to migrant women. And surely, ma'am, Lata ma'am, she is very close to us. She is one of our own past people, and has really captured all the aspects of psychological aspects and the challenges that are faced, and how the women, how the migrant women workers are coping up with such efforts. Very recently did we discuss in our staff meeting, and and with the children, basically with women students of our department, that we need to have a celebration of womanhood. I think it should be initiated into all our educational institutions, so that we have at least a month-long celebration on womanhood, trying to help understand the positive aspects of and allowing our youngsters to celebrate, and not only youngsters, all the male students also understand and get educated into respecting and cooperating with having a good gender perspective in respecting women, especially. And obviously, the last speaker is a very good friend of ours. She has been there. We had a very wonderful time in the faculty development program. She was an outspoken person and a very knowledgeable person, and we could see her in her erudite presentation of the theme, sustaining the well-being of women migrant workers in their families and work life, and the number of opportunities and schemes that are available and not fully implemented. And she has challenged us with the field action program of carrying those schemes into the community. And I think as professional social workers, we have an obligation to not only to introduce, educate, and also help people avail such facilities that are already existing, and especially for women. Therefore, I really see that these 2 days of hard work by the entire staff team and the student community has borne fruit. I am sure Dr. Aragraj would guide the entire department into taking this webinar into field action, and that's one which I always look forward to, which I think would be a meaningful exercise in making all the theoretical findings and all the ideas that have been accrued here, that finds a place in our neighborhood, which I think we will be doing justice to this webinar. So while I congratulate Dr. Aragraj for doing a wonderful job as given the opportunity from National Commission for Women New Delhi, we would like to put on record that from this we will have a field action project, suggestions for a field action project, and which will be seriously finding its way forward in the community. I thank everyone, and especially all the participants who have spent these 2 days interacting with the resource person and enriching this whole exercise of learning together. We from the department, we sincerely thank on behalf of our principal and all the members of the department, staff and students, for all the participants taking an active part in this 2-day webinar. Have a nice day. Thank you.
Thank you so much, dear father, for your word of compliment, and you meant it with full of your heart. And thanking all the people, those who accepted to make this program a great success. And as you said, all the sessions were really enriching and gave a lot of insights how women migrants are treated in different segments, and how we should look at them and help them have a good life, a decent, dignified life. Thank you so much. And I would like to acknowledge the support of our students, those who did MC, Jabba Jennifer, and Louisa, and all the students, those who introduced the speakers, and the staff members, those who took part in this webinar, and all the supportive staff. I would like to thank them. And very special thanks to the National Commission for Women for approving and sanctioning this webinar, and hope this adds a lot of meaning to the lives of the migrant women, women workers, and hope we will march forward to do something in life for this type of segment of people. Thank you so much. Dear participants, the feedback link is posted in the chat box, and in the YouTube link also, you can see the feedback link. If you don't get, you can also text me. I'll be able to send you the feedback link. So kindly fill up the feedback form. We will generate e-certificate for you, and it will reach your mail in 5 days time, within 5 days time. Thank you so much. Those who finish filling up the form, you can leave the webinar. Thank you so much. Thanks a lot.